take over. Yeah.
Right. Hello, everyone. It's nice to see that we've got a fair number of students. We will be recording this session and hopefully we will be able to upload it to the YouTube channel. So for those of you who are not here, please let them know that they should be able to watch. We'll get straight into the program. I know this is a very important day for you. You all are getting your results, so all the best. So basically, PeMSAA is the Alumni Association. At the end of this, I hope you will see why it's, it will be very useful for you to join. And the career guidance program, basically what we want to do right now is to not to tell you what to do, but to give you the practical tools and then like the structure of the knowledge, not all the knowledge, but to tell you where you can find the knowledge so that you can make informed decisions instead of just running at the first exam that you meet, which is what happens very often to all of us, right? So I'll quickly take you through the program. So first, Professor Abeysekera, now what I've put here is the batches of everybody. So Professor Abeysekera, who's a retired professor of pediatrics, will take you through some life perspectives, right? Making decisions in the next 5 years, because these decisions will affect your life. And there are a lot of things you need to think about that you may not realize right now, but later on you will realize, right? Then Dr. Sardha Hemapriya, who has probably taught all of you, will tell you about life in the Ministry of Health. Then Dr. Buddhika Dassanayaka will tell you about choosing PG fields in clinical specialties, particularly, right, in Sri Lanka. Then Professor Heshan Jayaweera, who has obviously taught all of you, will tell you about life as a university academic. Can I just check very quickly if you all can put in the chat that you all can hear me and that you all are okay, that you can share the screen? Can you all respond in the chat or verbally? That's fine. All clear? All right, excellent. Thank you.
All clear.
Right. Then Dr. Veranja will go through PG fields in laboratory and research, right? Some of the basic things that you all need to know. I mean, these are practical things, right? None of the academic stuff. Then we'll have a short break if we have time. And then Dr. Saman Walisingha, who is the Vice President of PeMSAA, and as you can see, he does many other things as well. We'll take you through some of the, the other things that to live, living a balanced life, right? Being a responsible doctor, being a responsible citizen, the importance of continuous professional development, ethics, and so on. Okay. And then, of course, I think there are maybe some of you who are interested. Dr. Ashan Gunaratna, who is the president-elect of PeMSAA UK, PeMSAA UK, will talk about migrating and working overseas, what you need to know about UK and Australia. And Dr. Sudath Rannulu, who was, as you saw, just talking to Tushara sir, will talk about migrating and working in the US, right? So that's your program. Right, yeah, it's the program. So I'll stop sharing there. Now, in the meantime, anytime you all have questions, right? Now, at the end, we will have an open forum to discuss, and the council, some of the council members, Tushara sir, and some of the speakers will be available for you all to ask questions. In the meantime, during this session also, if you all have questions, you all can put it in the chat, and we will answer as many as possible if there is time during the program or at the end during the open forum, or we will ask these questions from the relevant experts and give you answers, in the WhatsApp group or something. Okay. So without any further delay, I would like to invite Professor Chandra Besikta to proceed. Thank you, madam. Thank you for accepting it. To all the resource persons, right? Thank you for accepting our invitation. It's very, very kind of you to join. And madam, please.
Okay. Good morning. Thank you, Champa. Can you all see the slides?
Yes, that's
Yes,
fine.
madam.
Okay. Right. First of all, I would like to thank the President and the Committee of PeMSAA for inviting me to share my knowledge on life perspectives, making decisions during the first 5 years to plan your medical career. Before I start, I would like to congratulate all of you who have successfully completed your undergraduate course amid several hardships that prevailed in the country during the last 2 to 3 years. We should be grateful to the faculty and its staff, both academic and non-academic, who have worked tirelessly during the COVID pandemic, risking even their very lives to help you to complete this undergraduate course. By way of introduction, I am Professor Chandra Abeysekera, and I was a professor in pediatrics in this faculty, and I served this faculty for 25 years before I retired in 2016. Like all of you, I started my clinical career from this faculty way back in 1969 and served in several hospitals in the Ministry of Health like Kegal, Anuradhapura, Kurunegala for 16 years before joining this faculty as a university academic. During my era, life as a medical student was fairly straightforward. There were only 2 medical schools with 75 students in each batch, and I was fortunate to complete this course within 5 years without any disturbances. Within a month of getting the final MBBS results, I got my internship appointment and began to practice. Career guidance programs were not available to us, and we had to take independent decisions and sometimes even by trial and error to map our future. Today, 53 years later, the situation is completely different. There are 9 medical schools in the country with 150 to 200 students passing out from each faculty every year. Added to this list are the overseas students who are waiting to get their internship appointments. So it has become a very demanding and competitive process. Also, the waiting period for internship is longer and takes almost a year. This poses the question, what you can do productively during this waiting period. So the pre-intern period, I would like to provide you a few options available based on the experience I have had with students facing the same circumstances like you in the senior batches. Some students actually prefer to take a break, relax, and enjoy the life prior to starting a very strenuous internship that will leave you with very little free time. Several options exist for the others who prefer career engagement. Those who wish to be in the faculty and assist in teaching and research have the opportunity of joining a department of this or any other faculty as an assistant lecturer. Those who wish to engage in research will have the opportunity to become a research assistant to a senior medical academic. Others who wish to be in touch with clinical work will be able to assist a senior doctor in their private practice. This will greatly help you to be in touch with the clinical subject knowledge and also to help to get to know your senior colleagues in the profession, and will be some advantage to you when the internship commences. Further, engaging in research will be a plus factor for your CV as well. In addition, you will be rewarded for the work you do with an allowance which will help you financially. Then there are opportunities for students who prefer to follow different short courses in other faculties. Example, like MPhil in statistics in post PGIA, PGIS in University of Peradeniya, which might benefit your future career. There may be others who would like to get married before the internship, as the future plans can be made together with the spouse. For those who are planning to migrate at this stage, you will have to do PLAB, AMC and other exams before you leave. However, my personal opinion is it will be better for you to complete your internship here before you migrate. There may be others who would like to do something completely different from medicine, like gardening, cooking, meditation, etc., which might help in the day-to-day life. So whatever you do during this period of life, that is the pre-intern period, it is very important to have an aim where you want to go as a doctor, and this period of time is very important for planning your future. Then comes the second year, the internship period. Internship period appointments are given according to the order of merit in the final MBBS examination. And you need to decide the clinical area in which you want to specialize. Also, you must select an area that you like to be involved and enjoy. Most of you might receive the places you select, while a few may not have this privilege. Today, most of the hospitals have qualified consultants, and thus you should not be too disappointed working in a periphery. Also, you may feel more relaxed and be trained better in a periphery, as there will be more opportunities for clinical exposure. So when I look back at my past, the years I worked as a consultant pediatrician in the periphery prior to joining the faculty comes to my mind. These were some of the best and most productive years in my life, and your experience too might be rewarding as well. Then after completing the internship, you will have a period where you work as a post-intern before you get the proper appointments. After completing, all the medical graduates are absorbed into the Ministry of Health. So during this period, the post-intern period, it is better for you to do the appointments that you were not able to cover during the internship, as this will be the only opportunity for you to work under the guidance of a consultant, under the close guidance of a consultant. Further, you will be able to learn the clinical problems in the other specialties as well. So this is very important, especially if you are planning to work in the periphery and be a general practitioner. So having a knowledge in all the other the clinical problems in all the specialties would be important. So we are all unique individuals, and all of us have our different paths and our own individual purposes in life. So learning to figure out what is really important for you is very important. Your spouse, children, parents and their health, family, Friends and your financial situation may be the factors that influence your decisions. Think carefully and try to make the right decision that suits you and not the others. We will not be able to make everyone happy. Whatever the decision you take, life takes its own course. Some of you may have already decided or might prefer to migrate and work overseas. So there will be very useful presentations on this topic later on in this program. Remember that after 1 year of internship, you are eligible to do postgraduate exams conducted by the Postgraduate Institute of Medicine, University of Colombo. So any student who have an interest in doing further studies in their chosen fields will have to prepare for the relevant course of study now itself without wasting time. Those who plan to do postgraduate studies need to remember that a very strong commitment and immense sacrifice for several years is needed to achieve your goal. You also will have to learn to handle disappointments and stresses. But don't worry, we all have gone through this period and you need to develop resilience. However, if you decide to remain as a medical officer without doing postgraduate studies throughout your career, you can still be committed and enjoy the service you render to the community and have a satisfied and fulfilled life. So at this stage, I would like to identify some qualities. This is not the complete list. I have only selected a few qualities that you will need to develop as a practicing doctor. Of course, if you go through the net, there are long lists, but I have selected here only a few of these qualities. So everything won't be straightforward. So you are likely to experience setbacks along your way. And it's important to develop resilience, that is, the ability to withstand adversity and bounce back from difficult life events in order to reach your goal. You need to do so positively to serve the community. You should be empathetic, care and feel for patients. Spend some time listening to their problems. Talk to them and their family. Explain about the illness and educate them. Think of the patient being in front of you as your own mother, father, brother, sister, or a relative. Please treat the patients the way you treat your family members. Discuss with your colleagues and respective consultants if you are not sure of the diagnosis. Always maintain your respect and dignity. Should be committed, be confident, and competent. Another important thing is the documentation, which is very, very important. So write your notes very clearly and legibly. And it's very important to maintain proper records of your patients. Rather than writing in small pieces of paper, better to have proper records of your patients which you can always go back and refer. Because these, there are problems, right? So when you are writing referral letters, it's very important when you are referring a patient to a colleague or to a senior consultant to write an informative referral letter rather than writing only the name and sending. So when you are prescribing, remember to prescribe only what is required. Don't prescribe unnecessary drugs. Always remember that the patient in front of you is the most important person for you at the moment. We have a moral obligation to look after our patients properly, as we are in this position today because of free education that we received in this country, for which all the citizens in this country have contributed. I have served the people of this country for nearly 50 years, and on looking back, I can be very happy for the service I have rendered. I am sure one day all of you will be able to enjoy the same happiness as me if you do a genuine clean service to the people of this country. Before winding up, I must say that this faculty, the staff, both academic and non-academic, and PeMSAA has done so much for you to complete your course of study. So as a senior member of PeMSAA, I would like to invite all of you to take the life membership of PeMSAA and join hands with us to help the undergraduates and this beautiful faculty. So it was a pleasure sharing my knowledge, thoughts with you. Always have faith in your ability and the training you have received. Success will come your way eventually. Best of luck for your final exam results and for your future career. Thank you.
Thank you very much, madam. Thank you so much for those very sage words of advice. We will move on to the next presentation. I think Dr. Sardha Hemapriya is online. Sir, madam, could you stop sharing your screen?
Yeah, okay.
Sir, are you with us?
Can I share my screen?
Yes, sir. Yes,
Yeah,
sir.
yeah. Can you share my screen?
You can share your screen, sir.
Right, okay. Okay, first of all, thank you very much for giving me the opportunity to talk to you all.
Sir,
And it's my task is a very difficult task these days, asking people to remain in the Ministry of Health, Sri Lanka. Can you hear?
yes, sir. Hello. Yes, sir. We can hear, sir.
Hello.
We can hear, sir. We can hear you. So we can't hear you. We can see you again, sir, but you have to. Champa, shall we move to the next one? It seems Dr. Hemapriya is finding some difficulties with the connection. Are we ready to go for the next speaker or?
Yes, Buddhika, are you okay to? I think Dr. Buddhika was here.
Hello, Champa. Hi. Yes,
Yes.
I'm ready. I'm attending on the phone. Give me a couple of minutes to move on to the laptop.
Yeah, sure, sure.
Thank you.
Until Dr. Buddhika gets ready with the presentation, our students, all of you, we expect you to join hands with PeMSAA so that you can continue the good work that you've been doing all these years for your juniors will be coming after you. Okay? So please fill up the application form and send us. So you have been told that you can pay the membership fee once you started your internship. Okay? Please keep in touch with us even after leaving Peradeniya, and maintain contact with us and help your juniors who are going to come with years to come. We are sorry that these are all unavoidable issues with online sessions. So, and also we are not living in the ideal setup these days. So bear with us. We'll start off very soon.
Hello, sorry about the delay. I think I can share my screen now.
Yes, you could, yes.
Great. Okay, so I'll be talking for the next 20 minutes on choosing clinical specialties whether you should do it, and if so, why. My name is Buddhika. I think we've met during final year here. So this will be what we'll be talking about briefly. Talk about an overview of the clinical specialties, how you need to kind of find your purpose before you decide on what clinical specialty you go into. It might depend on what kind of person you are, and finally, how you need to prepare for this. So basically, the clinical specialties are the treatment related services in a hospital. You will have seen some of these in your final year. Medicine, surgery, obstetrics, gynecology, and pediatrics you would have seen. In addition to that, I'm sure you remember the anesthetists whom you met in theaters. And also some other fields are emerging as clinical specialties, and they are very interesting fields as well. You have emergency medicine, forgive the misspelling here. You've got clinical microbiology and other specialties which used to be paraclinical subjects, but now there's a clinical domain in those developing as well. So we've got a vast array of treatment related services or clinical services that you could choose from. The issue is, when you go into detail in any of these, you will find that these again divide into subspecialties. You could be a general physician in medicine, you could be a cardiologist, a nephrologist, a gastroenterologist. A cardiologist could be a cardiologist who does diagnosis, or they could be an interventional cardiologist who does interventional procedures like angioplasties and things like that. A surgeon could be a general surgeon, an orthopedic surgeon, a neurosurgeon, a vascular surgeon, a pediatric surgeon. So these areas differ vastly from each other in the skill sets that they require. So in the current practice, it might be better for you to have that end goal in mind instead of just thinking, I want to be a physician, or I want to be a surgeon, or I want to be a pediatrician, because within that subspecialty, you find a wide range of options available. So the question that you need to answer is whether you actually want to do this. And if we rephrase this, the question is whether you actually want to do this. As a final year student, you get naturally biased towards clinical specialties because this is what you see your teachers doing. You see all the teachers you have in your final year being clinical specialists in various areas. So that becomes the final thing that you see as you pass out of the faculty, and then you intern, and again you're working under a clinical specialist. So for over 2 years of your life, you will be exposed to only certain clinical specialties, and that naturally biases people towards this. If you select based on that, you might end up doing something just because everyone else is doing it, or because you see that that's the thing that's done. So I'm warning you against that. You'll probably need to guard against that and realize that to a certain degree you're being biased towards clinical specialties. There are many other options that you don't see apart from clinical specialties, such as general practice, going into paraclinical departments, joining a university, and being in a preclinical or a paraclinical specialty, migrating, so many things. So you need to guard against that bias. That's one thing. And secondly, when you are choosing a clinical specialty also, again, you need to guard against the bias of choosing something that you have seen. You only intern in medicine, surgery, pediatrics, and obstetrics and gynecology. You will not have any exposure to ophthalmology, for example. You will not have any exposure to clinical microbiology. You will not have any direct exposure to orthopedic surgery, urology, something like that. So you probably have to keep an open mind and keep inquiring over the next couple of years. Otherwise, you might just end up doing what you're familiar with. To a certain degree, those of us who do A-levels and do biology and then decide to come to the Faculty of Medicine have for a large part of their life doing what they are familiar with and what's expected from them. We have just gone with the flow, most of us. And there is a very real danger that you will go with the flow and decide to just do a clinical specialty that you have seen just because you are familiar with it, and that's what you think you're comfortable with. So the first thing I wanted to do is kind of warn you against just going with the flow and ending up there. Having said that, if you do want to select any of those clinical specialties, there are certain disadvantages that you will have to think of. You finish your internship by the time you are around 26 to 28 years old. A clinical specialty, depending on what you take up, means you will be enrolling in a postgraduate program. Depending on the specialty that you choose, there will be a certain period of local training and a certain period of overseas training. This whole process will eat up about 5 to 8 years more of your life. During that time, you won't have as many earning opportunities or private practice opportunities as someone who decides to go into general practice after their internship. Your hours of on-calls will be much different from a senior house officer or a medical officer in a hospital. You will probably be working more hours. The issue is working late hours is not a problem for you currently because being a student is all that you are used to having done from your A-levels to 5 years in university. But maybe during internship or definitely after internship, this is going to change. You're going to be having a job, right? And you will have to study for this examination while having a job, right? And you will have to carry out your training activities throughout these 5 to 8 years also while doing a job. The job is the training. And by this time, your home responsibilities increase. Your parents might be getting old. You might have to look out for them. Your siblings might need financial help. Your parents might need financial help. You might be married, right? No one is going to help you to get a loan anymore. You are supposed to do that by yourself. So all these things come up. Your vehicle needs servicing. You have to stay in a fuel queue for 4 hours. While doing these things, you have to work as a postgraduate and you have to study for this examination also. So it's going to be a harder task to balance work and time because of this reason. And that's not something that everyone is geared to do. And remember, in some specialties, your work gets harder as you go up the ladder. In some specialties, it's the opposite. If you take a medical ward, for example, in a general medical ward, an intern would work a lot. The next level would be the postgraduate junior trainee, the registrar. The registrar would have a certain amount of work, but that wouldn't be as hectic as the intern. And as you go up the ladder, there would be the senior registrar, whose job would be to supervise both the registrar and the intern, and then the consultant's work. And you would probably see that as you go up along the ladder, the amount of time that you need to spend in the ward gradually goes down. There will be other work, but the amount of time that you have to spend in the ward goes down. But in some other specialties, you might have to work more. For example, in a surgical ward, the job of the intern would be limited to simply seeing the patients and managing the basic things. But as your hand skills improve, as you get more and more competent doing more and more complex operations, you might have to spend more time operating. So the more skills that you gain, the more time you will be spending on them. Cardiology training during the first few years, they might actually have a bit of an easy job, but then once they learn how to do an interventional cardiological procedure well, they will have to be more busy than usual, because there's no one else who can do that, while the other work can be delegated to other people. So that also happens. So you need to understand all these disadvantages. So having discouraged you for the past 5 years or so from doing a postgraduate clinical program, let's talk a bit about the advantages. Now, the advantages largely depend on what kind of person you are. And like we'll be talking about next, you have to be honest with yourself about this. You have to recognize early on what kind of person you are and do something that fulfills that. You might want the prestige. You might want the power or the authority that this brings you. Or you might want to improve a clinical service. You might realize that if you are a medical officer, there is a limit to which you can improve a clinical service. While if you become a consultant one day, once you do a postgraduate program, you might be able to do something new. You might be able to give something new to a place, and that might satisfy you. So if you are that kind of person, this might have an appeal to you. Some people want a leadership role. They believe that that gives them either power or prestige. Other people realize that it is only a leadership role that helps them to make the administrative decisions that are needed to improve something, to change something, right? Some people enjoy teaching and educating. And the moment you go through a postgraduate training program, you will get more trainees. You will be teaching and educating everyone, from interns to registrars to senior registrars. And once you become very senior, you might even be training young consultants, right? And also, there is an income advantage as well once you have finished your training, but that is only in some clinical specialties. Some clinical specialties are not that established. So, for example, it's unlikely that you will become a multimillionaire if you decide to be a clinical microbiologist or an emergency physician, because in the private sector, there are very few hospitals where you can work as a consultant emergency physician in the private sector. So your opportunities are limited. While if you work as a consultant physician, you might be able to practice anywhere in the private sector. So those advantages and disadvantages are there. So lastly, we'll talk a little bit about this, and I'll wrap up there. I said that it's important to realize what kind of person you are. So a profession is basically defined as something where you get paid for something that you are really good at. And we all train to be professionals. And if you can strike this balance, then you're good. You get paid for something that you are actually good at. If you want to go a step further, though, there is a more complex diagram, right? So you as a professional are somewhere here. You are paid for something that you're good at. But do you love doing it? Right? Is it something that everyone in the world actually needs? Right? So what kind of person you are really defines which of those are your priority. right? Do you want something that actually gives you purpose in life, where the world needs it, you love it, you're good at it, and you get paid to do it? Or is it enough for you that you are paid to do it and you are good at it as well? If you're bad at it, then that's a problem. So that's something you've got to decide on early on. So this decision making becomes important depending on what kind of personality you are. So facing yourself is probably something you have to do very early. Having said that, what kind of person you are also defines what kind of clinical specialty you decide to go in. What are your people skills like? Are you uncomfortable with people? Do you like engaging with people? Big people or small people? Children. Are you comfortable with children or not? Are you an outgoing person? Are you an introverted person? Do you want daily excitement and stimulation, something happening every day in your ward? Or do you want to enjoy a bit of peace? Do you have a short attention span where you do something, you get instant gratification out of it? Or are you patient and you are happy to follow up the same set of patients for 5-10 years and see a gradual improvement in them, right? So all these things define what you can go into. For example, an emergency physician, a short attention span is fine. Wanting to see something, sort something out immediately and send it. For some surgical specialties also, that's fine, like emergency surgery. But that's not a good trait to have in a physician who has to manage a patient with long-standing diabetes for another 10 years and pick up every complication that they see. Okay. And are you happy with your finances? So all these factors will have to come into play. I'm just bringing these up because some of these you might have thought of, but certainly some of these you might not have. So that's why I thought of presenting it like this. So you will see many of these online, lots of diagrams of how your personality defines what kind of area that you want to go into. If you like everything, you go into family medicine. If you like nothing, and if your grades are okay, if you're a nerd, you go into pathology. So all sorts of flow charts are there. You can go through this for a moment before I go on to a different chart. So you like driving a shiny car around Los Angeles, you might decide to go into plastic surgery, penis jokes, urology. If you think love kids, you might go into pediatrics. If you think kids smell and you don't want to sleep, you might decide to go into general surgery. So many things. If you have ADHD, short attention span, and you're not, and you might need to go into emergency medicine. If you need to, if you're someone who has to focus on something and do a lot of patient work, emergency medicine might not be for you. Similar diagram. These are meant to be humorous, but they do contain a grain of truth in them. So all of these show that the clinical specialties depend on what kind of personality trait that you have. Lastly, a few words on how you prepare. So the training period in most clinical specialties goes through 3 steps. You enter by doing a postgraduate examination, and then you become a registrar. After a few years as a registrar, you do a second qualifying examination, and you pass that, you become a senior registrar. After you become a senior registrar, you have a fixed period of local training and a fixed period of overseas training. Once you finish your local training and your overseas training, you come back and the Postgraduate Institute of Medicine gives you what's called a board certification in that specialty. And at that level, you are entitled to call yourself a consultant. And your MD and board certification are complete. Most clinical specialties now have an MD. Once you finish that you have what's called an equivalent of a PhD in the Sri Lankan qualification framework. So if you're someone who wants to have a PhD equivalent at some point, an MD is an alternative there. So how do you get that? So you'll have to work out the entry criteria of the specialty that you go into. What period of post-internship is mandatory? Because you can't do many of these immediately after post-internship. Would you have to have an internship in that clinical specialty before you do it? Or would you have to do that as a post-intern appointment? Some things like pediatrics require this. Then you need to find similarly interested colleagues. This is not a journey that you can do by yourself. Okay, go by yourself. You'll have to find people who can help you through this. And you'll have to have an interested group who work together on this. You will have to find study courses. Sri Lanka offers plenty of study courses. For example, Peradeniya carries out MD training courses in surgery, obstetrics and gynecology, etc. There are plenty of consultants who do informal training sessions as well. You have to find out what these are and get into that program. You have to find study material. Your seniors will help you with this. In addition, there is plenty of online study material coming for almost every training program. The Postgraduate Institute of Medicine on their website has all the past papers from all the clinical specialties there. So you can just download the past papers from the PGIM website. And past MCQs are available in book form in various bookshops in the main hospitals, Colombo and Kandy both. So that's kind of the broad overview of what you need to do. And like I said, the most important thing you have and the most important resource is time. You're not a full-time student anymore when you're doing a postgraduate clinical course. So to study for this, you will have to do it while you're working a job, right? And the hospital job you do might be a heavy one. So the decisions that you make after your internship, during your post-intern period, the kind of appointment that you select might have to be geared to give you enough time to study for this as well. If you are interested in surgery, for example, you might not want to do surgery as a post-intern appointment, as a surgery SHO, because you might have lots of phone calls and be very busy, right? You might want to do something that gives you a bit of relaxed table time, maybe like work in blood bank or work in pathology as an MO there, because that would give you more table time that you can spend on study. While if you have to do on calls, they might be a difficult thing, right? So that brings me to the end of the talk. I'm happy to ask a couple of questions if we do have time. Champa, do we have time?
I'll give 2 minutes to see if the students are going to ask questions now, or they can ask questions during the rest of the talks, and we'll either forward to you or have them at the open discussion at the end.
Of course, sure. I might not be there at the open discussion, Champa, because I might have to pop it.
Yeah, sure. In which case, we will either have, Tushar sir and all will be available. Whoever can answer, or I will forward them to you, and then we will set them up for the students on WhatsApp.
Sure.
Students, you had some nice reality bites there. Take them to heart, right? These are things that, people learn by going through them. So these are, it's nice to know that it's huge nerds who get into PATH. I think, yes, thank you, Buddhika, and clinical microbiologists earn nothing. I can assure you that those who don't go into clinicals earn absolutely nothing. Yes, blink, Buddhika, blink. Right.
Switch my video off. One moment. Sorry, my expression may be too much.
Right. Okay, so I think the students are in shock. We will thank you for that. No, seriously, like these are the realities that you need to think about, and this is the whole purpose of the program. So thanks very much, and we will move on to Dr. Hemapriya will join us as soon as he can. We will move on to Professor Heshan Jayaweera, who will talk about life as an academic. Sir, are you with us?
Yes, Champa, I'm with you.
Thank you very much for joining, sir. Please go ahead.
Good morning, students, and I hope I'm audible. And in the next 15 minutes or so, I'll be talking to you about as to why you should choose a career as a university academic. Now, I believe all of you will already be thinking of various things of what you want to do. Some of you may have already decided what you should be doing. And there may be others who are not quite sure which way to go. And I was in the same situation when I finished my final MBBS. Right, so for whom is a university career is what we will talk initially, and then we will move on gradually. Now, the university will certainly encourage those who have excelled in their undergraduate career to join the university, because the university always thinks that those who are good or who are excellent in their academic work should continue as university academics. However, when you join the university, you are going to take up teaching, and then you might have excelled as an undergraduate, but if you are more into clinical work and you enjoy clinical work, then of course you might try to remain with the Ministry of Health. So if you have excelled and you're passionate about teaching, and teaching is not something that you can stop once you start. Once you join in, you're going to continue as a university academic, and then teaching will be part and parcel of your job. So I believe that those who want to join in have to have the passion to teach. And then, of course, it is not only teaching, there are other things that go hand in hand for a university academic. And that also includes research, because all academics, whether we like it or not, have to undertake research in a chosen specialty in most instances to ensure that career progression takes place. You will also need to undertake collaborative work. What I mean by collaborative work is that maybe you are in the Faculty of Medicine, if you join because you are a medical graduate very soon. And then, of course, the collaborative work will happen because you work in a university and you have other faculties. For instance, you might want to work with your colleagues in the Faculty of Science, maybe colleagues in the Faculty of Agriculture or Veterinary Science. Because
Sir, very sorry to interrupt, sir.
Yeah.
Are you moving the slides, sir? It's not full screen. We can't see it moving, sir.
Okay, sorry. Full screen.
Slideshow, it's not a slideshow. There. Fine.
Is it okay now?
Yes.
Yeah. Okay. Sorry about that. So the collaborative research that I was talking about will be, in relation to what you work, but there will be, other people who could contribute, and then you work as a team, which you probably may not be able to do if you're in the ministry. And in addition to the research, of course, when you become an academic, you have other things to do. You need to contribute to function the university. So the university hierarchy will depend on you to, kind of develop programs for undergraduates, various other things. We need to take part and contribute to undergraduate welfare, and also contribute to various other committees that, help to make the university function in a smooth manner. So what are the prerequisites that you need if you are considering a university career? For a medical graduate, well, if you want to join a clinical department, then of course you need to have either a first class or a second class upper as the basic qualification. Additionally, before you join, you need to have at least 1 year of experience, either in teaching, research, professional work, or postgraduate studies. So basically, for someone coming into the university straight off, once you have finished your internship, that will give you the 1 year of experience. And thereafter, you will become eligible to join the university. Now, for those who want to join the preclinical and paraclinical departments, even if you have not been able to secure a class at the final MBBS exam, if you have a first or a second class upper division, either in the second MB or third MBBS examination, then you will definitely become eligible to apply to join a preclinical or a paraclinical department. Right, so those are the basic attributes, but what additional things will make you or give you the chance to join a university? If you have had medals, prizes during your undergraduate career, that will be an added advantage, because there is a specified marking scheme for any recruitment in the university, which is extremely transparent. And therefore, you would get additional marks during your interview if you have won these things. If you have research publications, that too will give you an additional advantage. So for those who are thinking of joining in, I would strongly advise you to start working together, maybe with senior colleagues, and think about writing up things so that your name is on some of those publications. If you have contributed to extracurricular activities while as an undergraduate, I think the university is keen to recognize such individuals, because, as I said, the university has to have academics who are capable of, taking the university forward in other spheres as well. Then, of course, because you're going to be a teacher, I believe you need good presentation skills. You need to kind of work on them if you're not so good, because for you to get across knowledge, I think being able to present and to be able to teach in a way that the others could understand is, I think, a mandatory requirement. So how will your career progress if you come in as a university academic? Well, if you join after you finish your internship, then you will join in the category of a lecturer who is on probation. Once you've finished your probation period of 3 years, then you will be confirmed as a lecturer in the university. And then subsequent to your postgraduate qualifications, depending on what you want to do. If you are in a clinical specialty, then you will undertake your clinical training. If you're in a paraclinical or a preclinical department, then your postgraduate education would include maybe a Master of Philosophy or a PhD, for which I am sure the department, the senior staff in the department will help you to try and secure such a placement. So having done that, you move to become a senior lecturer, and then with research and other contributions and so on, which are assessed by independent panels, if you have fulfill criteria, then you can be promoted as a professor and senior professor and so on. So as you progress in your career, you would get more recognition on the one hand. On the other hand, the monetary gains or your salary is also will increase. Now, for those who think who are undecided, and if you have the basic qualifications, even after you spend some time in the Ministry of Health, maybe doing a postgraduate course, you can still join in and make lateral entry once you have got your postgraduate qualifications. And in such instances, you may be able to join even as a senior lecturer. So the pathway to become a university academic, you can decide when you want, provided, of course, that there are vacancies in the place that you want to join. So what are the advantages of joining a university as opposed to being in the ministry? I'm sure Dr. Hemapriya will enlighten you about the advantages of staying in the ministry. But let me tell you what are the advantages of working in a university. Well, it's quite obvious that your working community is going to remain the same. So it probably, as time goes on, you will get used to working with a smaller community. Whereas if you're in the Ministry of Health, you know that there are routine transfers that takes place every 4 years. So therefore, you would be perhaps changing your station of work, which would not be the case if you're in a particular university. When you're in a university, you're recognized as an academic. And if you have done a postgraduate qualification, maybe in a clinical specialty, so then you're a clinician plus an academic, which I think, in my personal opinion, gives you better prospects. You're recognized more. You have ability of, even if you want to apply and go overseas, I believe that when overseas universities, when you say that you are a university academic, you get a little bit of additional recognition. Of course, the university provides leave for you to progress in your career. If you join as a lecturer probationary, the university provides you paid study leave for you to go and complete your postgraduate training. Once you are in the university, confirmed in service and beyond the level of a senior lecturer, you can get paid sabbatical leave after 1 year for every 7 years of service. Additionally, there is vacation leave and so on, which will give you certain amount of freedom for you to engage either in research or to enhance your career or your specialty. So while you are in one station, it will give you the opportunity to plan your life, because you're not going to remain single. You will be married, you will have your children, and therefore, when you are in one station, you will be able to plan your life better, which will give you will know where you want to go, where your children would want to school, so on and so forth. The university also gives you flexible working hours. When I say flexible, it doesn't mean that you don't have to work. Well, you have to work, but there is no compulsion for you to stay in from 8 to 4. Well, if you want to go and collect data, and if you have no other clinical commitments or teaching commitments, you will be free to move. And of course, in some of the departments, especially the preclinical and the paraclinical, the weekends may be relatively free. Whereas if you work in the Ministry of Health, you're supposed to work every other weekend. Saturday will be a half day. Then, of course, I also believe there are others who will be willing to support you for mutual benefits. And those would be the other people or other colleagues, maybe from the same faculty or maybe from other faculties, who would join hands with you to carry out research or various studies. So I think that is a huge advantage. Furthermore, if you're in the university, you're teaching maybe clinical material, you teach undergraduates. So obviously you have to be up to date with what happens. So you will be up to date with all the current knowledge. You will have access to libraries and various other sites, which can come free if you are a university academic, which will allow you to continue your medical education. It also provides you the necessary infrastructure for whatever research you want to undertake. And of course, your superiors in the department are likely to help you. Well, if you want to go in for a MPhil or a PhD, your superiors might say, okay, I will find the connections, or I have people whom I have worked with and I can see whether they are willing to help you. So there are people who kind of guide you to your destiny. We spoke about collaborative research that any university academic could undertake if you are a university academic, especially with other faculties sometimes. And as a result of which, you will make connections with professionals of other disciplines. You will have people known to you from the Faculty of Science, maybe the Faculty of Engineering, and you might actually make close connections with people whom you knew as undergraduates, because they too have progressed in their careers. And then, of course, you will also have the advantage of being a supervisor for postgraduate degrees, because if you work in a faculty, and usually there would be individuals who would want to undertake MPhils, maybe PhDs, and they might want you to become their supervisor. So when these studies are undertaken and when research publications come out, then you also will be a co-author of some of these publications, which in turn will give you recognition internationally. So are there any drawbacks? I would say drawbacks. These are all questionable because it is the passion that drives what you want to do. Compared to the university, the Ministry of Health, your salary will hopefully be on par with the ministry doctors. But of course, when you become a university academic, you don't have additional benefits for working out of hours. So you might work over the weekend. If you work in the Ministry of Health, there will be remuneration. But in the university, working out of hours, you don't get paid. If you work in a clinical department, like what some of us do, we will continue to give honorary services to the Ministry of Health. So for us, now as a pediatrician, you all know that I work in the hospital, pediatric ward. We do on-calls, we look after patients, and that is at no additional benefit. So you work as a lecturer, especially if you're in a clinical department, you have to balance the teaching, you have to provide clinical services, and also there are many other committees and contributions which you need to make to the faculty as an academic staff member, right? And then of course you would have your family, children, so on and so forth. So it's quite a handful, but still, I think all that, if you think there are drawbacks, personally, I don't think so. Because if you enjoy your work, then you will certainly like to teach, like to see patients, and also contribute in an effective way to the faculty and the university. Then, of course, some might say there might be marking of answer scripts, setting of question papers. Well, they are part and parcel of a university academics life. I personally don't consider them drawbacks, and I don't think most of my colleagues think so as well. But that is just to put you on the perspective of what you might have additionally if you join as a university academic. So if you are interested, I think it's high time that you get involved in research with your whoever whom you want to. If you try to join as a temporary staff member to a department and then work on it. Improve your IT and presentation skills. And last but not least, go and talk to people whom you know in the same faculty, your teachers. Ask them, tell them that you have an interest. Ask them how it is best to move forward, because each department, I'm sure the staff members would be able to tell you what exactly to do rather than the overview I have given. So my dear students, let me conclude by wishing you the very best for your future. I hope all of you will pass when the results are released soon, and that you will be compassionate, caring professionals who will keep the Peradeniya flag flying high. Thank you very much.
Thank you very much, sir. I'm sure there are questions from the students. Students, if you have those, please put them in the chat, we will get to them at the discussion at the end. I think Dr. Hemapriya has joined us online. Sir, are you there?
Yes, I'm there.
All right, sir. You can share your screen, sir.
Right, okay. And
Sir, have you opened the presentation, sir?
yes, I have opened. Can you see?
Yes, sir. If you can put that into slideshow, sir, the full screen.
Right,
Right,
can
sir.
you see?
Yes, sir.
All right, okay. I'm so sorry about the technical problems I had, because I was working in the theater, so that's there I tried to communicate, but now I am at home. Okay, thank you very much for giving me the opportunity. Anyway, students are waiting for their results. As soon as they get the results, then they are thinking of what we are going to do. Of course, as Sri Lankans, we are very proud of our history. As you know, Mihintala, you can see the oldest hospital in the country, about 2,500 years ago. So from that time, you can see still the setup of the hospital is similar to us, you know, cubicle by cubicle. And you can see the Behet Toru in close by. And still in our Ayurvedic physicians use this Behet Toru. So we are proud of our history. Now you can think of what you are going to do. I'll tell you at the beginning, you can do business. You can do business, something medical related. Like you can start a channel center, or you can start a drugstore or pharmacy. So something medical related you can do because you have a medical knowledge. Or you can start something non-related. There are plenty of doctors doing non-medical related business. You can import things, you can sell things. People are doing flower business. Some people doing the dal and rice. So like that you can think of doing business. Next, you can think of become an artist. As you know, there are singers, there are painters, and there are actors, the drama actors. So like that, you can become artist, giving up medicine completely, you can become artist. Of course, you know, that's not a very stable profession to carry on. You can become a private general practitioner. You can leave the Ministry of Health. You can start on your own general practice and become a general practitioner. So you can open up a private hospital. There are many people who have done it. I'm sure in the country there are so many hospitals owned by doctors. So they are doing very well. And not only they are earning money, they are doing some service for the people also. The next, of course, you can think of doing a postgraduate exams and become a postgraduate trainee. Ultimately, you end up as a specialist. Oh, nowadays, everybody is thinking of going abroad, find a job in abroad and go and work in abroad. Of course, that's a wise choice at the moment. Of course, if you can't do all of these things, you have to remain in the Ministry of Health. But in my talk, what I'm trying to do is to show you what can you do still if you remain in the Ministry of Health. I will tell you the attractions, why you should remain in the ministry, and end of the day, you can decide what you're going to do. If you look at the screen, you can see number of doctors in the country working for the Ministry of Health. Of course, in Sri Lanka, about 95% of doctors work for the Ministry of Health. As compared to India, only 30 to 40% doctors working for the ministry. So of course, Sri Lankans, we think always we get the free education, we get free university education, and we should serve to the country. Of course, we have a job guarantee when you come out from the university. That's the medical graduates have that advantage. Not like other undergraduates, when they qualify, there's no job guarantee. But in our Ministry of Health, they give a job for you. So what you are trying to choose is what you're going to do. So I will just to brief you, because when you're undergraduate, you don't know about the health service in this country. Just to brief you about the health service in this country. You can see Ministry of Health and Healthcare and Nutrition comes under one ministry. Now, of course, ministries have changed, don't worry, but I'm talking about the ministries we had about a couple of months ago. There are teaching hospitals, you can see on the side, right side of the screen, there are teaching hospitals which comes directly under the Ministry of Health. So that's one of the advantages of the working in a teaching hospital, because you directly comes under the Ministry of Health, Colombo. Then under the ministry, there are provincial health ministries. As you know, there are 9 provinces in the country. So each province has provincial health ministry. So there's the provincial director of health, PD, we call the provincial director of health. And under them, there are regional directorate of health services, we call the regional director or RDHS. Every district has one RDHS. So therefore, according to the district, there are RDHS. Now, say for example, in Kandy, the central province, there's a provincial director. There are 3 districts, Matale, Kandy, and Nuwara. So there are 3 RDHS. So that's how it goes. Now, under the RDHS, there's a curative service. That means there are hospitals comes under. Those hospitals, either provincial, the provincial hospitals, provincial general hospitals, the district hospitals or base hospital. I'll come into that later on for detail. Then on the other side, they have the preventive service. Now, I just want to let you know, there are so many doctors work in the preventive services. Say, for example, MOHs. So each RDHS has about 15 to 20 MOH areas. And there are 20, more than 20 now, there are AMOHs also. So each RDHS, now there are about 40 to 50 doctors working as MOHs or AMOHs. So still doctors working in the preventive system. Of course, there are non-inward patient institutions. They are in the country, small institutions. You can see it's called the district hospital, small hospital, where only a couple of beds available for inward patients until they transfer. There are rural hospitals, there are peripheral units, and there are central dispensaries. The good news is now, of course, all these small units have medical officers qualified in MBBS. So you have plenty of jobs available. So this is 9 provinces. So 9 provincial directors are there. 9 provincial director officers are there. So once you get the post-intern, not post-intern, the doctor's appointment in the Ministry of Health, according to your merit list, you get allocated one of the places in this provinces. So these are the RDHS. You can see in Central Province, you can see Nuwara, Kandy, Matale, those 3 RDHS areas comes under Central Province. So it's like that working. So similarly, you can see how it enlarges when it goes down. The 9 provinces, there are 25 districts and 26 health regions, RDHS, and 331 divisional secretariat and 340 MOH divisions. So you can see there are a lot of doctors working as MOHs in this country. Of course, the hospitals, as I explained to you, until the district hospital, there are inward patients. And after that, you get the central dispensary, healthcare centers like rural hospitals. And there are no inward patients, but still they provide healthcare for the people. If you look at the chart, I mean, just want to highlight, this is the country, the presentation of doctors per the population. So if you can see the numbers, you can see according to the RDHS areas, you can see some areas, some say in Colombo, you can see there are a lot of doctors compared to the country. So density is very high. And there are places like Nuwara, very few number of doctors. So this is, you can see very well. So some areas, consideration is more doctors working. Some areas, there's a lack of medical officers. The same thing you can see from here. The more doctors working in the Colombo district, right? And you can see Nuwara and the Anuradhapura, these areas, you get few number of doctors. Kandy, of course, we are blessed. We have our consideration is less than Colombo, but still you can see there are so many areas without good number of doctors. So what you can see, the message I want to tell you is still there are enough vacancies available in the country. Problem is, nowadays everybody wanted to stay in Colombo, Kandy, Galle, like large cities. I don't know why. Even the specialists I'll see, the moment you come back from abroad after your training, you try to stay in Colombo or Kandy, or probably in Jaffna or Galle. They are very reluctant to go into the peripheral hospitals. But I'll tell you, after working so many years in the periphery, I have worked in Ampara, Anuradhapura, Matara, Kurunegala, Kegal, Kuliapitiya. There are so many places I have worked, but I enjoyed very well in those places as I enjoy working in Kandy. So therefore, don't hesitate to go and see the country and serve people in the periphery. Now, say for example, this is District Hospital Apuressa. Now, it looks very ancient. Nowadays, these hospitals have actually come up very well. Now, this photograph is a very old photograph I've taken when I went to Ampara in 1994. The peak of the war, I went to Ampara Hospital. It was, as soon as I entered the hospital, I was shocked to see the facilities and the people are doing. So most of the patients on the beds, and there are so many patients, like they are on beds and they are on the floor as well. Now this is Ampara Hospital today, so you can see the difference from 1994 to now. So therefore, my suggestion for you, don't worry to go in the periphery now. The hospitals are very good. That's my advice. So this is a new unit came up in Ampara Hospital. You can see the ICU. So all the new equipments and very clean and very sophisticated ICU. So my advice is don't hesitate or don't think these hospitals are without facilities. The moment you say Mullaitivu, everybody reluctant. I can remember we worked, we organized a workshop in Mullaitivu and everybody says, oh my God, are there any toilets? Are there any water to drink? And you can see Mullaitivu Hospital is nowadays is one of the very good hospitals in the country. So you can see things have improved and you can go and work. This is usually the peripheral hospital you see. But you can see, looking at this, it has more homely appearance than the new appearance in new hospitals. So when you go there, you will be welcomed very well, and you will going to be probably the head or the chief medical officer in these small hospitals. So you should be proud of it, proud of working in these places. So when you go there, you can work as outpatient department doctor, because outpatient department is the heaviest the department in any hospital, even Kandy Hospital same. So you can contribute your service in the outpatient department. So when you are working in outpatient department, you can use all the experience you have gathered during medical school and the internship and use for people just come every day for their illness. Of course, you can see the difference from the previous doctor. Now this doctor was having terrible time because there are so many patients around him. I mean, there's two ways you can think of. One is, oh my God, there's too much of work, too many people for you. But on the other hand, you think, there are so many people depend on you. So many people waiting for you. So you are doing a tremendous service for the people. So think like that. So that will boost your work in the peripheral hospitals. Of course, now most of the hospitals, They have accident emergency units or the ETU, emergency treatment units. So you can contribute going there. If you want to do active work, you know, emergency treatment unit is always active. There are so many patients coming every day with emergencies. So if you are an active doctor, you want to do something very actively, you can participate in one of these units. So you have the option. It comes in the ministry list, the medical officer in ETU or medical officer in accident emergency. Of course, another job you can choose is to work as a senior house officer. You are going as a medical officer or the senior house officer. Actually, you can choose the particular unit, even you are not doing postgraduate. You can choose a particular unit you are interested. Now, this doctor, a senior doctor, is not a specialist, but still he has skills, he has experience, and he's serving a lot of things to the people. The ophthalmology. So there are so many doctors, not postgraduate qualified people, or no, not postgraduate trainees, are very well experienced. So you can choose that either. Now, this is a neurosurgical unit. You know, our neurosurgical unit, there are plenty of non-postgraduate doctors who are experienced, they're doing surgeries, and they take decisions and they cure people. So you can become something like that if you don't want to do postgraduate. Still, you contribute a lot as a senior doctor. You can become a surgeon, you know, in all our surgical units, orthopedic, the neurosurgical or gastrointestinal. There are so many surgical units. There are plenty of senior medical officers or the medical officers. So you can join and you can contribute a lot by assisting, clerking, diagnosing, and managing patients in wards, as well as you can become a surgeon as well. You know, most of our units, about more than 50% of work done by doctors, non-postgraduate people. So you can join and still you are doing a lot of service for the people. In my unit, I tell you, I have 4 senior house officers who are not doing postgraduate exams, but they are experienced. And there are people experienced in 10 years. And they are much experienced than the trainees who comes. So they contribute a lot of work for the unit and they cover up a lot of work. So you can become somebody like that. They do cesarean sections, they do abdominal hysterectomies, they do other surgeries, and they are very proud of being senior doctors, medical officers. That's what I'm telling you. If you want to become somebody like that, still the pathway is there. Or if you are very good at managing high dependency patients, like in ICU or the surgical ICUs or medical ICUs, then still you have a chance, because in your post-intern list, you get post for ICU. Now in Sri Lanka, we have a severe shortage of doctors who are trained in ICUs. So if you can get training at ICUs, even that will help you to go and work in anywhere in the country, any unit, because we have managed severely ill patients with the experience. So that's another option you can have. Even when you go abroad, if you have ICU training, if you have worked in ICU, you have very good chance you can get a job in abroad, because they also waiting to get ICU trained doctors. And to tell you, I don't think you have experience of campaigns or the prevention aspect of the Ministry of Health. There are so many campaigns and so many institutions comes under the Ministry of Health. Most of them are preventive, the institutions. So the two I have shown you, the STD program and the blood transfusion service program. So this is the list. If you see, there are so many preventive aspect campaigns under the Ministry of Health. So if you are not if you don't want to do the clinical work, and you're very good at community medicine or the public health, and you want to become a public health doctor, there are so many jobs available in these places. You can see now, say for example, Family Health Bureau is a huge institution. There are about more than 40 doctors are working, and under them there are so many doctors are working as MOMCHs, and there are a lot of work they are doing in the Family Health Bureau. So you can see like that, there are so many. Same thing with the Health Promotion Bureau. There are a lot of work. There are a lot of new, the people we want have new ideas to promote health. So you can see there are so many institutions you can join and do. And there are not only that, there are so many other institutions comes under the Ministry of Health. You can see now more and more doctors, MBBS qualified doctors we need, rather than administrative grade non-doctors. So my invitation is for you all, if you don't want to do clinical work, join this preventive aspect, the community medicine, public health sector, so you can do a lot of work for the country. You're not doing only one patient, but entire country, people will benefit your work if you join one of these people. But there's another option. You can join into the administrative work, administration in the Ministry of Health. Either you can go to the Ministry of Health, or there are provincial directors, provincial director's office in every province, and there are RDHS offices. So you can join as administrative work. And if you want to do now, you can do the postgraduate qualification. You can get the postgraduate qualification here, the health administration. And of course, you have this administrative ability. If you were a good team leader, I think you should do medical administration. Again, I'll tell you, rather the civil people coming into the administration, I think if a doctor can come to administrative post in a hospital, you can definitely develop the hospital, because you know what you need. So this is Maharagama Apeksha Hospital. If you can remember this, one of the good directors has done a lot of work. Like there are so many directors where I have worked. Now, a classical example, I tell you, Dr. Saman Walisingha, who was the previous director of the Canteen Hospital, and he did tremendous work. He has completely changed the hospital. So you can see, rather looking after one patient, he has completely changed the hospital to give a better care for people like us. People are working as active people. So there's another area you can choose in the Ministry of Health. You can see, when you the name you say Chavakatyeri, you think very ancient building and very ancient. I mentioned to you earlier. So this is MOH office in Chavakatyeri. They like these MOHs. You know, these MOHs are the silent the gods, one would say, because they are not highlighted by the people, because they work behind the screen. I know I have worked very closely with MOHs throughout my career for the last 30 years. So they do tremendous amount of work. And they look after most of the pregnant mothers. So that's one of the reasons I appreciate their work, because the maternity care, mainly the primary maternity care, done by MOH doctors. So please join. Even you like obstetrics and gynecology, maternity care, even you are a medical officer of health, MOH, you can contribute a lot for the people in this country. Of course, you can become a specialist in the hospital, Ministry of Health. As you know, when I went abroad for my training, the first question usually in the abroad they ask, do you go back to your hospital? Are you planning to go back to your country? Of course, most of the country people come from other countries like India. They said they are reluctant to answer that. But as soon as they asked that question from me, I said, yes, of course I go back. Yeah, why? You can stay here now. But I said, no, I'm going back because there's a job waiting for me. In the Ministry of Health, there's a job waiting for me to come back and take over. So that's why I am going back. But if I am going to be here, I have to hunt for jobs. So my home country, that is not there. So they are waiting for me. So I have some responsibility to go back. So of course you can come back after qualifying, come back and join the Ministry of Health, go to the periphery. That is the place. There are a lot of people waiting for you. You have young blood. I always say young consultants are coming. You are young now. As when we were young, I went to Ampara when I was 30. So you can do actually a lot of work because you are young. You are not afraid of anything. You have energy. You are not disabled. So go to the periphery and treat for the poor people in the periphery. So that's my advice. So at the end, I'd like to tell you a few things about why doctors should remain in the Ministry of Health and provide their care to people. Doctors positively affect patients every day. Remember that. Positively. I don't think any doctor negatively affects the patient. We can really help people. If you're in the Ministry of Health, you can really help people. If you're in the private sector, probably you have to get some money from the people. But here, you have the free medical service and you're the person who's going to deliver the care. So you can really help people if you want to help people. And of course, doctors have quite a bit of job security with the Ministry of Health. You know, nowadays you have a good income. I would say, I don't say the best, but you have a good income compared to our days. You don't believe. In 1985, my salary was 1,750 rupees. Now, of course, a junior doctor can get 100,000 rupees. So you can see income improved, not the best, not the optimum, but you can with your extra duty. Second one is you have pension. You have a pensionable job. I don't know, still the pensionable schemes available, but the pension is one of the things you expect from the government servants. Other thing is being a doctor is never boring because every day you see a different thing. I would say I'm a gynecologist. Every day I see different ovarian cysts. You can see small cyst, big cyst, malignancies, adherent one, complicated one, burst one. So it's not boring. You're not going to see in the everyday everything, same thing. So that is another advantage being a doctor. And if you, of course, if you think you are boring in one place, you can go and join another unit. Say if you're doing ophthalmology today, if you think ophthalmology is boring after about, say, a couple of years, you can go and join the emergency treatment unit. So it's never going to be boring because you can apply and go for different kind of specialty. And of course, we use science. We are not blindly treating people. No trial and error. Of course, we use science. We use the experience as well as the research and the guidelines and the protocols. So of course, we are using science every day. We are scientific. Of course, you can do more than science. If a poor mother comes, you treat her, and if you realize she needs some help, you can give that help, go beyond the science. It is not you are treating the disease, but you are treating something else. Classical example is the patients come with gender-based violence, patient after rape, sexual violence. It's not the science. You can go beyond and help them to get the legal advice, to get the security, to counsel, the psychological support. There's so much you can do beyond the science if you're a doctor, remain in the Ministry of Health. And there's, of course, we have always an opportunity to teach. There are medical students, there are nursing students, there are nurses, there are midwives, even there are minor staff. you can teach. So you have plenty of opportunity to teach, because in the medical profession is the noble profession, as is the highest in hierarchy in the profession of health service. So you are the team leader, you are the knowledgeable person, so you can teach every day for the people. So if you would like to teach, this is the best opportunity. Stay in the Ministry of Health, work for the people in hospitals. And of course, you are working with the multidisciplinary team. If you are a general practitioner, probably you don't have a team. But if you are working in a hospital, there are nurses, as you say, there are nurses, paramedical people like radiographers, MLTs, and nurses, midwives. There are so many people work with you, and you get help from everybody. And of course, people believe you. That is one of the things in this country we have. When you go abroad, you can see the patients asking thousands of questions, and they are very, very knowledgeable. They know the treatment modalities available. But here, our poor people, they believe you. If you tell them, we have to do a cesarean section, nobody come and argue with you. Nobody will ask why you are doing cesarean section. Because in this country, we have a privilege. People believe you and your decision, your treatment. Of course, working in medicine can be immensely satisfying. This is one of the things you can't get from other jobs. I'll tell you, sometimes now I go in the night, I get a call saying mother is very bad, bleeding. I go in the night, probably I'll operate for a couple of hours, 2 to 3 hours, give 10 pints of blood, do a very difficult surgery, and save a mother, sent to ICU. When I come back home, when I put my head on my pillow, you won't believe, you have maximum satisfaction that you can't get from money, that you can't get from the people. So that is one of the things when you're working with the Sri Lankan citizen in this country, we are working for these people, and you believe country is not Colombo, country is not Kandy. There are very poor people in the country. There are a lot of people needs your care. So doing that, you can do an impact on our healthcare system. If you work hard, you can change our healthcare system. So you probably upset at the end of the day, being tired, physically, mentally, with working with other colleagues, the handling difficult tasks. But have you heard, say doctors are second only to God. People won't say that unless you gain trust of them. So my invitation for you, if you want to satisfy job, you will be happier if you work in the Ministry of Health and serve our poor people in this country. Thank you very much. Thank you very much.
Thank you so much, sir, for joining us and for giving those very valuable insights into life in the ministry. And there's so many different options, and the positive realities that the young doctors now can deal with. I'm sure they have a lot of questions. Students, you can always, not students anymore. Young doctors, you can always put them in the chat, and we will deal with them as much as possible at the open discussion at the end. Thank you once again, sir.
Okay, thank you very much for giving the opportunity. Thank you.
Welcome, sir. So we are a little behind schedule, so we'll move straight on. And next, I'd like to invite Dr. Veranja, who will be talking about choosing a PG field and about laboratory and research.
Right, thanks Champa, and thank you PeMSAA, Tushara sir, and everyone for giving me this opportunity And hello, young doctors of the 14-15 batch. Good to see you all, at least virtually. I can recognize some of your names. I hope you can hear me. Champa, am I audible?
Yes, all good.
Yeah, thanks. So because we are lagging behind time also in a bit, I'll quickly go through this. So my topic is choosing a PG in a lab and a research field, and I must confess at the start, some of these opinions expressed are personal, so other people may disagree. Right. So I think just like the previous people, particularly just like Buddhika previously elaborated on, first of all, you will need to decide whether you're going to do a PG or not. Right now, Hemapriya sir and Heshan sir showed you the paths that you can take in the Ministry of Health or in the university. But that, I mean, university, of course, you do need to do a PG, but if you're remaining in the Ministry of Health or if you're going into full-time general practice, this is a decision you have to take first. This is a personal decision, right? And there is no correct time or the best time or the worst time to decide when to do a PG. It depends on your personal circumstances, your liking, your disliking. It can be thought as a part of your career development, or it can simply be a personal goal. And that personal decision may be for idealistic reasons, as some of the speakers before elaborated. Things like, you want to do something for the specialty you're going to choose. You want to do something for the field to uplift the condition. Or it can also be for practical reasons. Some of the practical reasons are unfortunate in certain instances, because sometimes some people now choose doing postgraduates as an option to get out of toxic stations or distance places. Right now, these are some of the realities that we face, but deciding on whether to do a PG or not is a personal decision that you, once you finish your internship, need to take. So the aim of my talk is to briefly sensitize you on the available options for lab-based postgraduates, either as a specialist or as a researcher. So if you want to do a PG in a lab-based field as a medical graduate, you basically have two paths, right? One is a MD path, which is through the PGIM for the time being, and the other one is a research path, which is based on doing a PhD. Now, the decision, if you are someone who likes lab work, if you are in your personality, you are someone who is a bit like me, an introvert, not a people's person, right? And if you want to get a bit away from clinicals, then a lab-based PG may suit you, right? So now, because there's a wide variety of fields to choose, even in these paraclinical specialties, think about your passion. Think about your future plans. Do you want to stay and work in Sri Lanka, or do you want to migrate? Because some of the specialties have a very good job market in other countries. For example, medical microbiology trainees invariably get a lot of job opportunities, particularly in the UK. And if you want to stay back in Sri Lanka and serve for the country, which is what we would like you to do, but we all know that the reality may be different for reasons that is beyond your or my control. If you want to stay back in Sri Lanka, do you want to stay in the Ministry of Health, move to the private sector, or come to the academia? Or do you want to, be someone more global, stay a bit in Sri Lanka and then maybe serve in institutions like the WHO or the UN? All these opportunities are there for medical graduates. And also think, how much clinical exposure do you want or would you like? Now, right now, just after the final MBBS, you might be of the mindset, I really want to get away from clinicals. But please don't be in a haste to take this decision, because things might change. So have a very open mind till you finish your internship and also till you finish your RHO period. Talk to a lot of people, because some people come to the lab field and then they get a bit disheartened because there is a lack of an adrenaline drive in some ways, right? So these are the things that you might need to think very, very deeply and reflect upon before you choose either the MD pathway or the PhD pathway into a lab-based OPG degree. So let's take the MD path first. So the go-to place for you to understand this yourself is the PGIM website, right? Now, when you enter the faculty, we give a handbook, right? So as budding doctors, you may still have it or you may not have it. And I'm sure at least one or two of you may have gone through this book. But before you start a PG course, make sure that you visit the PGIM website. And similar to that handbook that was given to you when you entered the faculty, there are prospectus for different MDs in the PGIM website. Right? So I'm just going to take an example which is closer to me, even though I haven't done a PGIM course. This is the PGIM prospectus for Diploma in Medical Microbiology, and you can see the program overview is given there and the whole prospectus is given there. Right? So maybe even during your pre-intern period, browsing through this site will give you good first-hand information rather than getting it from someone else. So this is a good starting point for you if you want to do an MD in a lab field or even in any other MD, because all the information is there. Right, so let's come back to the lab fields in the PGIM pathway. Now, interestingly, all the paraclinical specialties have a master's or a diploma followed by the MD. Right, so you have the option of continuing with the MD or stopping with the master's or the diploma. So when we take the the typical paraclinical specialties, there's the diploma MD in medical microbiology, in virology, medical parasitology, clinical hematology, histopathology, and chemical pathology. So these are the things that are available as of now according to the website. I hope I haven't missed anything. So think about these specialties from your experience that you have had so far, right? But also be mindful that what you have seen as an undergraduate is only a fraction of the things that are done by specialists of these fields, right? So therefore, talking to these specialists who have who are approachable and who are friendly, and getting a wider understanding of the scope of work of these specialties is very important before you actually take a decision on these things. Now, in addition to the directly lab-based diploma MD courses, there are these related but not directly paraclinical specialties like transfusion medicine and venereology. And of course, then there are the non-lab paraclinical MSc MDs like ComMed and Informatics. And of course, molecular medicine is still at the diploma MSc level. So these are the degrees that are available for the paraclinical sides, either lab or non-lab. I think I may have missed a couple in the PGIM pathway, right? So going through the prospectus will give you the job description of a specialist or a graduate of these degrees, what opportunities you have, and also things like prerequisites, what are the requirements you need to do if you are to enroll in these programs. And all these diplomas and MScs have a screening exam before you enroll into that. So what type of things are asked in these? So all this information can be found in the website. So I do invite you to actually go to the PGIM website and find these out. So before you actually make a decision, I think I'm repeating some of the things that I told earlier also. Do think very carefully on how much clinical engagement you would like. Right, so some of the paraclinical lab-based specialties do have significant clinical involvement. Medical microbiology certainly has. There's ward rounds, antibiotic prescriptions, multidisciplinary team involvement, things like that. And clinical hematology definitely has a major clinical component, right? So, if you want best of the both worlds, like clinical plus maybe lab, then those are the things that you may want to go to. But if you really want to be doing lab work in lab, you might want to think of something else, right? And what subjects interest you most? And of course, fortunately or unfortunately, payment does play a role. So private practice options, you might need to think about these things and talk to people who have gone through these specialties and who are already specialists in this field to identify the possibility of this. And also very carefully look at the training program. These training programs are lengthy because there is an initial taught course component followed by the clinical or the lab training component. And in addition to the length, you may also be posted to different places in the country, because not all the labs are equally equipped, and God only knows what labs will be equipped or will have sufficient consumables in the coming few months, but let's hope for the best. So your training stations will vary, and you will need to go to these different training stations. So look at these things in relation to your plans for your life. Remember, your PG becomes only one component of your life now that you have graduated from being a full-time student. You have your family, you have your career as a doctor, and PG is only part of it, right? And also, if you want to stop it halfway through without proceeding to the MD component, see whether these qualifications will help you to get your promotions in the Ministry of Health, like your grade 2, grade 1 promotions, right? Talk to someone who is working in the Ministry of Health and see which qualifications of these are accepted for those. And do talk to everyone that is there. I'm going to keep repeating this because this is very important, and talk to more than one person, because what I say or what someone else says will be different to how someone else has interpreted it. And if you are interested in a lab field, maybe you can think of doing a RHO placement in a lab to get first-hand experience. However, do not let that one station put you off, right? So these are some of the tips that you can maybe take into action. Right, say from the MD pathway, where you will become a specialist in a given field after you complete that with the foreign training or overseas qualification, let's move on to the research pathway. Now, research pathway has different components. So there are master's degrees with a research component that have a certain Sri Lanka qualification framework equivalence, or there are full-time master's research programs like MPhils mostly. MPH is actually a master's with a research component. That's a public health thing that is not so popular in Sri Lanka, but very popular in other countries with medical professionals. And of course, there is the PhD. So whether you can do a PhD straightforward or not will depend on a lot of things. So if you are dead sure you want to go into the research pathway, you need to then select a subject that you are interested in doing, right? Again, you have to think of the relevance of the subject and the interest it will generate in you. Remember, this is a long time, lifelong, almost lifelong commitment that you're going to take, because there's always the chance to revert. However, when you're trained in something for such a long time, reversion takes a lot of guts. And once you decide on a subject, you need to decide on a university where you're going to do this research in, or your master's or the PhD or the MPhil, right? So do you want to do it locally, full-time, while working, taking leave from your work, or part-time while you're working somewhere, right? And then you need to think of selecting a potential supervisor, and of course look for scholarship opportunities. Now here I'm talking more about going to another country to do a research postgraduate degree, right? So because I think a couple of young doctors have already asked me, and I know there is an interest from the forums that I have been engaged in reading, that medical graduates are also thinking of using a research PG pathway as an alternative to seek, maybe an opportunity to go abroad. So if you are thinking of something like that, think of a subject, think of a university that you want to approach to, look at the website of those universities, identify potential supervisors, email them, and together with them try and look for scholarship opportunities, because research PG course fees are quite expensive. Even taught PG MSc course fees in other countries, and even in Sri Lanka now, are pretty expensive. So looking for scholarship opportunities are important. And when you're looking for universities also, you'll need to have an understanding about the league tables for foreign universities, and there are different groups of universities, and you will have to have a realistic assessment of your chance to apply for those universities. And you need to be sufficiently motivated in the subject to not get disheartened by the rejection letters that you will invariably get, right? Okay, so if you're interested in this path, then you'll have to have an interest in research, and you have to have a track record in research. So your pre-intern period is a good opportunity for you, just like what Heshan sir said a while ago, right? Get engaged in research, and try and see if you can build up a publication record, and do brush up your CVs. I know medical graduates are not particularly good at doing their CVs because we are guaranteed a job. We don't really do our CVs. Now, I have seen a lot of you who have done excellent work and have excellent qualifications, but have forgotten to put those things in CV. And there's a couple in your batch also. I think I have told you personally as well. And do improve your email etiquette. If you are emailing someone abroad, they expect you to reply, and there's a certain way to address people. You have to be polite. So do look into these things during your pre-intern period, because these are not things that we learn during our course. And improve your English, because if you're trying for a PhD or a master's in another country, you will need to face either IELTS, TOEFL, or some other tests where your English language is extremely important. So do use this pre-intern period to brush up your English as well. And have a realistic assessment of self. Simply because someone has a first class from, maybe Peradeniya, it doesn't mean that you will get accepted for the first time in Harvard or at Harvard for, because you need to have the supporting things. Our degree doesn't have a big research component. And unfortunately, some of you, because of COVID, were not even able to complete your research. So therefore, you need to have a realistic assessment and look wider for the universities. There are some very good Asian universities that you might want to look for if you are planning to follow the research pathway, right? And also during the pre-intern period, aim to develop transferable skills that are important both in your clinical practice if you decide to stay back, or that will be helpful in your securing a PG position abroad in a research pathway or in Sri Lanka. There are so many massive open courses available through universities like Johns Hopkins that will, give you certificates on statistics, bioinformatics. Try and follow a couple of them during this period, because that will help you, right? And also do learn to network and market self. This is the unfortunate reality in the research world. No matter how good you are, if you are uncomfortable in marketing yourself, your chance of getting a position in competitively, falls a bit, right? So if you're thinking of moving to research field, also think of the job uh, prospectus, because moving to full-time research is almost like a complete career change, right? So you do need to think of staying in Sri Lanka versus migration, and also whether you want to move in academia, or are you okay to work in the industry. Pharmaceutical industry is a huge job market for PhDs in medically related fields. And if you are staying in the Ministry of Health, if you want to stay in the Ministry of Health, uh, what will a research degree actually get you, right? I also don't know. I have a batchmate. He was the first in my batch to finish a PhD. He's currently a medical officer at National Hospital. His PhD knowledge is not actually used that much, right? So therefore, if you want to stay in the Ministry of Health, if it is something that you are passionate about, you want to develop yourself, it doesn't matter if it doesn't give you anything, then that is fine. But you need to take it that if you do a PhD and decide to stay in the Ministry of Health, if you are not recognized for that, then you need to face that reality. Even though MD PhDs are equivalent, in the Ministry of Health, PhD will give you only a medical officer's post as far as I know. You will not be considered as a board certified specialist. So with that, let me also give you some myths that are there, because I would like these myths not to be the reasons for you to take on lab-based postgraduates, be it the MD pathway or a PhD. There's this thing that lab-based MDs are gendered, that females do it. There is nothing like that, right? Anyone can do it, and there is no, some people will not find it easier to do it, and these are not better suited for one gender. And also lab-based MDs have less work, or the courses are of less work. These are also myths, right? Because if you actually become an MD in a lab-based field, these fields are, even though they have been in existence for over 20 or 30 years in the country, if you compare the level at which the Ministry of Health labs in Sri Lanka or the university labs in Sri Lanka are with the global standards, you can personally put your effort and develop these things. And for some paraclinical areas, even though there is a lot of clinical potential, the clinical potential is not being developed because of personal reasons. So therefore, there is nothing like less work. It all depends on you, right? You can actually move the field forward, facing all the obstacles if you want to. And also then there is this, this thing of academic PhDs have a 9 to 4 job. No, there is nothing like that. If you have that impression in you, that is probably because what you have seen is not the actual examples of a true academic, right? So I'm sorry to say that, but if you go to other countries and see how academics work, they work 24/7, because you need to be open for student contacts 24/7. Your research is, your research work shouldn't, the universities shouldn't be closing at 4 p.m. You should be able to work 24 hours to do your research. So at least your generation and part of my generation will need to take this forward if we are to develop. Right? So these should not be the reasons for you to choose research careers or academia. Right? And the same for the next one. And also doing an MSc is an option to get out of the periphery. Please try and not to use or misuse this, because I've seen a lot of people doing this, and then you're not interested in the subject, you waste a lot of resources, someone else's opportunity to come and do this, and again you will be somewhere just cursing that degree. Don't let that happen to you. Okay? Right, so what are the advantages of doing a lab-based research? You do play a wide role in healthcare. No matter what paraclinical or lab-based research or MD pathway you take, you're not that visible, but you are part of healthcare system development and you can play a major role in it, right? And it definitely will suit some personality trait. And you will not have acute emergencies in the traditional sense, not life-saving emergencies at times, but you still do get emergencies. Even if you are a PhD working in a lab, there are emergencies. For example, in Sri Lanka, one of the commonest emergencies we have to come and attend to are freezer breakdowns and electricity cuts. These become emergencies to us. Even during holidays, we take rosters, come and see if electricity is intact, because if these things are not there, we can't actually work. And some of these things have probably not become visible to you during your undergraduate period. Right? So with that, I would like to end this talk just saying keep your eyes and ears open during internship, because there's a huge chance that your thinking pattern will change during that time. And if you decide to postpone doing a PG, remember that it is never too late to start a PG, and talk to more than one person in your field of interest. And no matter what you decide, to not do a PhD, to not do a postgraduate, to do a postgraduate in a lab-based or a clinical field or a non-lab paraclinical field, to join the academia, to continue in the Ministry of Health, to go to private sector, ethics do matter. Right? So with that, I will end my talk, and in the end, if you have any questions, I'll be around, and you all know my email address, and you can always drop me an email or come and talk to me in the department. Thank you once again to PeMSAA for giving me this chance.
Thanks very much, Dr. Veranja, and for giving those perspectives. Next up, we have Dr. Saman Walisingha. Dr. Saman, I think you're there.
Yes, I'm here.
All right.
Champa, are we? Ashan is there. I think Ashan has to leave. Is that right? You're going to go ahead. Oh, Ashan, are you okay to?
Sorry, Dr. Ashan, you're muted.
Can I do the presentation if I can? Because I need to leave. Thanks, Saman. Yeah.
Yeah, sure. Okay. So Dr. Ashan will be talking about migrating and working overseas. Please go ahead.
Thank you, Saman.
Okay. So can you see the slides?
Yes, sir.
Okay, just about me. Just. Right. Champa, can you see the slides?
Yes, sir. All good.
Okay, thank you. So good morning, everyone. Probably good afternoon to you all in Sri Lanka. First of all, thank you very much for PeMSAA for giving me this opportunity to talk about the opportunities in the United Kingdom. So, and many congratulations to all of you for completing your MBBS program. I'm sure you all have had a lot of sacrifices, but if you think the next 20 years, your future and the career just starts. So you are at the bottom of your career path at the moment. So if you are thinking being a consultant, academic, GP, or other opportunities, most of the countries, you have a very set direct program, as I indicated in this straight arrow. However, so far you have had the opportunity to concentrate on your studies mainly, but now in the next 10 years or 20 years, you will have other things to consider, such as your family, your health, money. Not only that, you will have to think about your future, proper planning. What are your ambitions, opportunities, training, exams, and if you're migrating to another country, the immigration requirements. So all this becomes important, and majority of you, including if you look back past, majority of us will not have a straight journey. You will have ups, you will have downs, and you may not be able to do things the way you want. However, if you plan and if you have an ambition, at the end, you should be able to reach there. So specifically, if you talk about training opportunities in the UK and working in the UK, I could see three main pathways. So if you are an MBBS doctor, you could straight away try to migrate to UK and look for job opportunities. I will go to that little bit in details. But other straightforward options are to secure postgraduate training in Sri Lanka, and then every trainee will have to complete overseas training. So use that as an opportunity to come to UK. And other thing is join a university in Sri Lanka, and then normally they offer you study leave for 3 to 5 years, do a PhD, and then you can come to UK. So the coming to UK is just start of your journey because it fulfills one of the visa requirements. But after that, your proper training program or whatever you want to do starts. Normally for any training program, it normally takes about 12 to 14 years. I will show you some slides next. In the next couple of minutes, you will hear me talking about few of these things. NHS, it's one of the largest health service in the world. It employs about 1 million population, and it treats a huge number of patients every day. Normally, the expenditure of NHS annually, it's about 150 billion pounds. So if you think the larger scale,
It's a huge amount invested in the health system in the UK. There is a registration process guided by the General Medical Council, acronym by GMC. It's a regulatory board. So if you are practicing in the UK, everyone have to demonstrate that your standard of practice align with the standards that GMC expected. I was trying to think whether do we have a similar thing in Sri Lanka. Organization. I think GMO is the only one I could think of. I'm far behind with the current medical or career pathways in Sri Lanka, so I could be wrong. But in addition to that, we have organizations like BMA, that is British Medical Association, that represents the doctor's body. And if you look at other things, JRCPTB, that is organization coordinate the training for majority of the trainees in UK. And then you have different royal colleges, Royal College of Physicians, Surgeons, Pediatrics, and etc. And all your visa requirements and how you could come to UK depends on the Home Office. So all these factors matters when you decide to come to train overseas. So you have to be aware of, there are these days very easy to access each of these units because it is over the internet. So you just need to search, and then there are so much of information you could gather. So if you look at the process, specifically thinking about the UK, at least a majority of you will stay in Sri Lanka based on the previous experience. About 25% of you will think about going to another country like Australia, States, or UK. So if you are thinking of going to coming to UK, there are two main tests that you need to do while you're in Sri Lanka. That is a PLAB test, and then IELTS, that is an English language proficiency exam. And then you can apply for jobs in the UK. There's an NHS jobs website. Most of the time, people get an opportunity to get a non-training job first. And then once you are in UK, you go through the processes and the requirements, and then you can apply for a training job. As I mentioned, in addition to that, you need to get registered with GMC, and tax and immigration requirements you need to be aware of HMRC. So when you apply for NHS jobs, there are thousands of people applying for the same job, especially when you go higher up. But then you need some additional qualifications. So the research has a big weight. So if already some of you might have 1 or 2 publications, if you have done some undergraduate research projects, if you haven't done it, maybe you have done some studies, but you didn't have the opportunity to get it published. So consider very hard to get at least a small publication or a presentation or abstract presentation, because that will immensely help if you are coming to UK. Some of you will get second classes, first classes, gold medals, which is extremely good. But outside the Sri Lankan context, these things wouldn't matter that much, because what they're looking for is some other attributes of you, which I will explain in a little bit later. So PLAB test, if you already know, this is a written exam and there's a practical exam. Written exam is very easy because for people who have finished their final year examination, so it is a theory-based exam. And if you are thinking of coming to UK, I think you should try to do it now because your knowledge is fresh, and I'm sure you will do your internship in the next 12 months. During this period, you can use that time to complete the PLAB test because your knowledge is fresh, and it is much easier to do it now rather than late in your career. The practical exam, again, basic things, but what probably different to what you have learned, there's a lot of emphasis on communication skills and empathy, how you demonstrate empathy to patients. So I'm sure the current curriculum of your medical training might have addressed some of these now, but this is also maybe different to compare to the training here. And then you have to do the English test. A lot of people find it difficult, but I think if you prepare well, it is not that difficult to get a score around 7 for each aspect. Is reading, writing, listening, I think, and comprehension. So these are the two basic things that you need to do. And doing this, completing this roughly might take about a year. And again, these informations on the internet, I tried to put the reference at the end of the slide so you can have a look if you are interested. So visa requirements in the UK, it changes all the time because especially with the Brexit, the visa system changed. I'm not an expert on this, but I had to look at yesterday. And normally there used to be a work permit or tier 2 visa, but now it's been changed to health and care visa based on a point-based system. But gladly, UK need a lot of doctors from outside because NHS is huge and there are a lot of vacancies everywhere. But majority of the vacancies, you have to bear in mind, they are non-training jobs. That means cater to provide service rather than addressing on training. So, so you have to look at the immigration website. There's a booklet, but if you are a MBBS qualified graduate and if you get a job offer from UK, I think you easily can get 70 points. So this highly skilled migration program allow you to settle in the UK compared to other visa. So other visa, like work permits, you have to come and work after a certain period. You cannot stay, you need to go back. So this is something you need to think about. Again, getting organized these things at least will take about a year. So why you should come to any other country like Australia, States, and specifically UK? The training program for junior doctors in the UK, well structured, and a lot of opportunities for education and improve your skills. And you have to demonstrate continued professional development by attending courses, seminars, reading research publications while you are doing your job. And access to research, every junior doctor is encouraged to do research. There is a good standard of pay that it is enough to live and a good, comfortable life. And working conditions in the hospitals are satisfactory. More importantly, I think you have a lot of access to new procedures, you can develop new skills, and less weekend work because you have a lot of doctors. For example, the hospital I work cater for about 1 million population, and we have 24 cardiologists in that hospital. I think more than 600 consultants. But you have 20. So therefore, we work in a rota very similar to in Sri Lanka. So we have less weekend work. But when you are working, the intensity work is high. And also, when I compare with other countries and other practices, I feel that you have more time to enjoy life. You can travel, you can do sports, hobbies, more time with your family. And I put as a pro advantage that you don't have to do, or you can't do much private practice. And then if you think the future, there's a good education to your children. And more importantly, like, there is a very good transport system. I travel about 40 miles on daily basis, but it takes me about 40 minutes. 40 miles, and the transport structure is good. So therefore, travel between cities, between hospitals, hospital to your work, it's much easier compared to other countries. So what are the cons? I put within inverted commas because this is subjective. Some people find the climate is difficult to acclimatize. We don't have, you have 4 seasons, so the winter, autumn, spring, most of the time temperature is less than 20 degrees, and summer, if you're lucky, the maximum can go up to 28. So it's not a big factor, but when you start living in the UK, especially in the first few years, you feel that. And the training period is long. So I will explain why is that. It takes about 10 to 16 years to become a consultant. So but during that time, during your training period, you are paid adequately, you can enjoy life. I don't think it as a con, but if you are thinking of the time factor, some people might think it is a disadvantage. And the junior training from FY1 until you become a registrar, it is streamlined. So you don't need to apply for jobs in particular hospital. But once you finish that, when you apply for consultant jobs, it is extremely competitive, especially in certain specialties, popular specialties. So you have to compete with graduates all around the world, including Oxford, including Cambridge, for the same job. And if you look at the NHS practice, you are accountable for everything you do. So there's a lot of documentation, and every action you do is documented and you are accountable. So there are issues with litigations from the patients. So you have to have enough indemnity cover these days to protect yourself. So you can, as a medical profession, we know sometimes you can do mistakes, but if you are negligent, then it becomes an issue. And if you do certain mistakes, you have to be open about it. I think I will highlight that a little bit later. And other thing is a lot of people who are in these jobs say their job is stressful. So it is again subjective. I think stress is a common factor in our life. So if you take that approach, I think it won't be a big issue. So it is stated, I think the UK system is trying its best to give equal opportunities, but in reality, if you are a foreign medical graduate, I think you have to at least be twice as much, you have to work as much as twice the time to get additional qualifications and work hard if you are applying and seeking for the same job. This is becoming less and less because the assessment systems are very focused now, but I don't think we have yet reached 100% equal opportunity to everyone. And as you will expect, culture is different in the UK compared to Sri Lanka or any other country. But I think the most important thing I learned is that you have to accept that it's different. And if you try to live like a foreigner in UK, I think your life becomes difficult. But you accept the culture, and if you take the good things, I think it becomes much easier. And you need a lot of planning. So if you're working in the UK, you have to at least plan your leave about 6 months ahead. You can't just take off but you have a lot of leave, about 35 days. You can take leave in a year, but you have to plan your day, your week very well. So a lot of people, my colleagues and family, sometimes get frustrated because access to healthcare and investigations is not straightforward as easy as in other countries. You can't go and get an X-ray whenever you want, even if you are in the medical profession. You have to go through your GP and you have to follow the rules and the system. So you can't go out of the system and get these. So sometimes you feel this is a disadvantage, right? So as I mentioned, every doctor in the UK every year, you have to demonstrate through an appraisal that you are in line with good medical practice. The practice in the UK is patient-centered approach. That means patient decides what treatment he needs. So you, as a clinician, you can offer all the treatment options available, but patient is in the driving seat. So it's a patient-centered approach, and there's a lot of emphasis on empathy, honesty, and teamwork. So if you're working in a hospital, even if you're a consultant, you are just member of the team. There's no significant hierarchical system. Everyone contributes to the day-to-day activities, and they all treat you equally. Communication skills play a big role, and you have to demonstrate in your appraisal that all of these things I mentioned in this slide are satisfied in the appraisal process, and you have to send a report to General Medical Council at each year by appraisal committee. And I have put something duty of candor in red. This is something probably you're not used to. So if you by mistake do something, a small harm to the patient, sometimes especially with the specialties involved procedures, certain things could go wrong, but at the end you manage to rescue it and do it and save their lives. However, at the end of that, you have to go and explain to the patient that you did a mistake, and but this is what I did. So you have to be very transparent. So which is, I feel it's a good thing. But this has become now a kind of legal or requirement within the profession. So other than your qualifications like MBBS, your gold medals and your degree, there's a lot of emphasis on other attributes. I'm sure I have seen you got a very nice program organized by PeMSAA. So they are addressing some of these. I'm so pleased to note that. There's a lot of, that's why I thought I'd spend some time explaining this. So if you go to the specific things training in the UK, what I find is the training system is structured and streamlined. So everything you do, you have to document in an e-portfolio, you have a curriculum, and you have assessment based on the curriculum. So each of the trainee will have an educational and clinical supervisor, and there's a lot of support to the trainees, which I have noticed it's a great strength in the training system in the UK. And during your course of training, you are assessed not only at the end by, if you think it's a Royal College of Examinations, but every day you are assessed based on your work-based experience. And if you are, for example, if you are a trainee in cardiology, you have to do procedure like angiograms. So your supervisor will supervise you and look at how you do angiogram, and he will assess you during the training. It's mainly not to pass or fail, but how he can be improved, what are the things needs to be done to cover those aspects. And then you discuss that at the end of your attachment or a day with the trainee. So I think that is, which is a very good thing. I touched on the communication skills and teamwork. And also there's a lot of weight on feedback from your colleagues, nurses and patients. So you have to demonstrate during your training. You have to do 25 to 30 feedback forms, and you have to demonstrate their feedbacks. Again, you take this as a positive thing. Sometimes even intentionally you might behave differently, but from the feedbacks I have learned, sometimes you can change your practice, which is a good thing at the end for the patients. You have a lot of exposure to governance, audit, research, and guidelines. Majority of the treatments are based, especially if you think of cardiology, based on guidelines. So you have to demonstrate your practice is adhered to the guidelines. So you have to continue your education. Even after you becoming a consultant, you have to demonstrate that you are up to date. So field like cardiology, everything is changing every day. It's very difficult with your busy work life, but you are given time, allocated time to do that. So that I find it very different to other countries. In your job plan, you are given a time to improve and do these things as allocated time. And for other trainees, there's flexible training opportunities. So you can work part-time even during your training time. So some people choose to do clinical work in 50% of the time because of other commitments, and they come back to full training. So there are opportunities, and some junior doctors can take gap years, they travel abroad. These are a few things I thought should highlight. So the first, after your MBBS program, there's a 2-year foundation training program similar to your internship that you will do in Sri Lanka. And then in FY2 year, you go through 6 different areas like general practice, psychiatry, community service, community work, and other specialties, cardiology, pediatrics, etc. So after that, you have exposure to many specialties, then you will decide what you want to do in your specialist training. Again, I have put website at the end of the slides. It gives you all the information you need. So if you think you want to, everyone should think that you need to become a consultant. So I have taken the physician's training pathway as example. So after 2 years of foundation training, then you need to do 3 years of internal medicine. It's called IMT1, IMT2, IMT3. So during this period, you do your membership exam. So at the end of 3 years, you will have MRCP. And once you have MRCP, and then you can apply for specialist training. So the duration of specialist training change. For cardiology, it's about 5 to 6 years, but other specialties roughly around 4 years. So once you finish that 4 years of training, you have a specialty-based exam. and then and like KBA, that is for cardiology knowledge-based assessment. And then you get this specialty certificate for registration. So one that is called CCT. Once you get the specialty registration, then you can apply for consultant jobs. But in the UK, as you could imagine, the access to procedure is less because a lot of trainees don't get hands-on much in the specialties where there are a lot of complex procedures. So most of the trainees end up doing a post-CCT fellowship in another country or within the UK. Because of the competitiveness of the process once you apply for jobs, about 30 to 40% of us have to end up doing an academic degree within that. So PhD, or in UK, you call Doctor of Medicine because you are already a doctor. So PhD is, if you are getting a research PhD for a doctor, it's some universities called MD, Doctor of Medicine. So the completely, it takes about 12 to 16 years. So that's a long journey. But recently, there's a lot of emphasis and interest of becoming a GP, general practitioner. It's a formal thing. I heard that Sri Lanka also getting this recognized. So soon after your 2 years of foundation training, you can have 3 years training in general practice and you can become a GP. So the advantage is training is short, and at the end, if you think of your salary and other benefits, very similar to a consultant. But if you ask a GP, their job is very intense, stressful. Initially, there's a lot of interest among the UK trainees to go into general practice, but that trend is fading away these days. So if you look at the next few years, there'll be a lot of opportunities for international medical graduates to join the GP training program, especially if you have some qualifications from other countries. So if you think of medicine, there are about 35 subspecialties you can choose and select, like interesting area like aviation and space medicine. I don't know anyone who is doing it, but there are opportunities to do all these subspecialties. And sometimes we used to have combined specialties. Sometimes the clinical pharmacology and therapeutics can combine with acute medicine, but clinical pharmacology, it's almost fading away because pharmacists and pharmaceutical industry has taken off. So there are changes, but there are a lot of opportunities to find your interest in these specialties. Similar to surgery, there are a lot of subspecialties, pediatrics, and genomes and other things. So this is a brief slide. If you look at the registrar level training, it is called ST3 to ST7. So on your left-hand column, it tells you at the end of each year what you need to do. So when you come to ST7, you have to demonstrate that each of these columns, like multi-source feedback, patient surveys, management, teaching skills, advanced life support, and your work-based assessments called case-based discussion, and consultant report, education supervisors report. So you need all these to at the end of your training and each year to go to the next level. So it is well structured. The trainees are aware, but there are a lot of effort and emphasis to do that. But if you organize, I think you can do this very easily. I think it's just a snapshot to demonstrate to you that there is a very good structure if you're within the training program. So I think I have addressed this before. If you once you complete, you can apply for jobs, and it could be very competitive, especially for some specialties. So there is another route of getting CCT. So if you are coming from another country, if you are a consultant, for example, in Sri Lanka, and if you want to come and work in the UK, there is an indirect way of getting CCT certificate. It is a very complex process. You have to demonstrate a lot of evidence, and it has to be accepted by the GMC and then particular training board. But there are people who has done that. So this is not the only route. There is another route. But if you want to come to another country, I think in my advice, in my experience, you have to come very early in your career. So more you delay, I think getting to an end job like a consultant or academic or a professor, it's becoming much challenging. Not your salary or other benefits wise, but your job wise, if your aspiration to become a specialist in a particular area, that will become challenging. So I thought I'll demonstrate a slide about salaries for doctors. I think a lot of you might be thinking of. So junior doctor salary start about £28,000 a year. But what you have to bear that in mind, that everything you earn in UK, you have to pay tax. For consultants, for example, out of this salary, you have to pay about 40% tax back. So whatever you calculate, you have to calculate 40% back. And especially for junior doctors, other thing I need to highlight to you, you are in a very privileged situation. Sri Lankan medical education in one of very few in the world that everything is free. In UK, it is free, but at the end of your training, once you start earning, all the graduates have to pay back your university's fees. So when you start as a junior doctor, you are already in debt of about £60,000. And you can spread how you pay it back. You can pay it back over 20 years, but you are in a very privileged situation because of the free education. So you have to be thankful to the education system in Sri Lanka. And I don't think many other countries have this free education system as we have it in Sri Lanka. Again, if all this information is online, so you can get that. I will show you a book. So in practically, if you think of the practical aspect, so you got your MBBS and then do your PLAB and IELTS. Once you have done that, look at the NHS website and apply for a job. So majority of will need to get a non-training job, because that will help you to get your visa requirements. So once you are in UK, you can do membership exams and a research degree or other qualifications, etc., until your visa requirements are fulfilled and you have enough qualifications to apply for a training job. Once you are in the training job, then it's straightforward. You will end up as a consultant or a GP. Other option is come and do a clinical job. And if you are interested in research, then you apply for a university to do a PhD or a MD, and you can become a researcher or academic. So some people choose, actually, I don't want to do a training job. I just need to live in the UK. So in that case, there are opportunities. You can provide the service as a trust doctor or a staff grade doctor or associate specialist. There are disadvantages with that, but there's no career progression. But if that is what you want, it is not that difficult. So finally, if you are thinking of a GP, there is a nice booklet on the internet. I have put the website address. Please go and have a look. All the details are there, and I think this is the best thing I could find on the internet, and this gives you a very comprehensive information if you are thinking coming to UK. So some of the information I got it from this book. So keep this website address in your mind if you think, and this is a very good book you should read. So I think we are at the end. I need to highlight, be proud of being a graduate from Peradeniya and then PeMSAA alumni. I think this is one of the best taught courses in the world. I always think if I could do this, I'm sure majority of you be able to do this. So aim high, be prepared, don't hesitate to challenge yourself. Sometimes take risk, calculated risk, it might pay off, and then sky is the limit. But there's a big but, what a lot of people, senior people will tell you, during everything, enjoy life, and good luck. Thank you.
Thank you very much, sir. Very quickly, there's one question. How long does are the PLAB results valid for?
It's valid. It's valid forever. So I'm not sure whether there is like you have to reset. As far, I mean, I did it long time back, but I think it is valid once you are done. But IELTS, I know you can't. There is a period. It's only valid for a certain period.
Right, sir. And just very quickly, another one. What do you mean by non-training jobs?
So the non-training jobs, so the job requirements decided by each trust or each hospital. Like, for example, if you think Peradeniya Hospital, the director of Peradeniya Hospital will get a certain number of doctors from the training program. We'll say that the hospital needs 100 doctors, but you get only 90 training doctors. So the hospital will spend money to get some doctors to work in that particular hospital, but it's for service provision. So these are the non-training jobs. So you don't need to do all the things I showed you, the training. There is no training structure. There's no big supervision. You are there to provide the service. You get all the other benefits, but you cannot progress in your career. You have to get into the training system.
Right. Thank you very much, sir. And thank you so much for joining us from the UK. Young doctors, we will be giving you contact information at the end of the session. So if, I mean, as you go through all these sources of information, if you come up with more questions, you can contact PeMSAA UK. Please become members, so you can contact PeMSAA UK. And you can certainly ask for guidance, and there's a mentorship program there as well. Dr. Ashan, thank you so much.
Okay, and also you can share the slides which I sent you with the graduates if you want. Yeah.
We will. Thank you, sir.
No problem. Thank you.
We will move on now as we are behind schedule. Dr. Rannulu from the USA, sir.
Hi, good morning. Hi, I'm here. Can you hear me?
Yes, sir. Sorry. Thank you so much for staying with us, and we're very happy to hear from you, sir.
Okay. So shall I share the screen?
Yes, sir.
Okay. Is everything good? Awesome.
All good, sir.
That's the slideshow. Hi, good morning. I'm Dr. Sudath Rannulu, and I'm from Dallas, Texas, from United States. Congratulations for the graduating class of Med School 2022. And I'm very happy for you. I know it's a bumpy road, and in terms of the country situation, congratulations. and hats off. Yeah. It's 2 o'clock actually. It's almost 2 o'clock in the morning. It's a long day for me, and I do apologize in advance. I'm a bit sleepy, but I will try my best to deliver my speech. It will be in Singlish because I love my mother tongue. And being a Sri Lankan and being a Sri Lankan American, I like to talk in Singlish. That is true that we all were educated through the free education. And we all have a citizenship obligation to pay back. In India, they produce skilled labor to the world, to the US, Europe, and Australia. So they develop a concept called the non-resident Indians. That concept was started in 1931. That means you are Indian, but you are working in a different country as an Indian. Still you are an Indian, though you are an American. So you bring back money, whatever they earn, and the expertise and the knowledge back to your country. That is the concept.
Sorry to interrupt you. Could you put the slides on full screen, sir?
Slides on what? Let me see.
It is still, it is not on
Slideshow.
present slideshow, sir.
Slideshow and from the beginning, right? Okay. Yeah, you got it? Okay. Okay. Yeah, and sorry for that. The NRI concept was started in 1931, and basically, if you consider all the tech jobs in the United States, most of the the doctors, more than 50% of the United Kingdom, the healthcare system, are from Indian origin. But when it comes to United States, the tech jobs or the medical field, Sri Lankans are a noted minority. The reason why I understand, we had the nationalist movements and we always produce doctors and expertise to back home. And in the same time, we had a good quality of life. People didn't want to leave the country. But I just want to tell you, so there are ways for you to pay back. Even you make a decision. I'm not trying to justify leaving the country, but I'm trying to tell there are ways where you can pay back to back home. I know we were educated with the free education. We need to pay back to our country. So you can invest in Sri Lanka. You can train, actually you can help train the PG trainees. You can the sponsor, the medical students, or you can select an orphanage or select an elderly home. You can feed them weekly basis. So you can pay back. I really don't think you need to worry about leaving the country and make a decision to to work in a different country. Yes, we were born Sri Lankans. We love our country. That's the most important thing in our life. I just want to tell you the few things I know it could be important during this time in terms of the economy. So when the Pakistan, actually, I'm not trying to deviate from my topic, but I'm trying to give a background information. The Pakistan, actually, they defaulted on their finances. The expatriates who live in different countries, they have sent 3.1 billion US dollars back to Pakistan. At least it is actually a short-term relief for them. So let me briefly tell about myself. I was born and raised in Kampaha. I went to Peradeniya. It was an adventure. So I was an average medical student, and I did a lot of extracurricular activities. And I captained Sinhalese debating team, and we won the Senaka Bibile intermedical faculty debating. We were the co-champions. And I played rugby. I received University Colors Awards. And I played badminton. And in the same time, I was involved in student politics. The reason what I am trying to tell you, you don't need to be a brilliant student. You can be an average student to do post-graduation, or you can, whatever the field you like to move forward, select it, and you need to make a decision, and whether it is right or wrong, and work on it. In Sri Lanka, after the internship, I worked for 5 years. And then I got the green card lottery. It was a tough decision for me. I know it's taking a decision to come to United States, where very few graduates moved to United States and started the residency. Very few. And it's a new thing. Even it was uncertain for me, to make a decision and come here. But I had to come here. I had to make a decision. So this is what I was actually, one civil servant told me, so that make a decision whether it is right or wrong and work on it. And these are life lessons. This is what I actually work most of the time, and my philosophy of life in decision making. And also, I can remember one of my best friend's father, when I was had to make a decision in my life. He told me, more risk you face, more risk you take, more you are benefited. Yeah, that is important. So I know it's harder, when you are young and energetic, and in the same time, when you're blessed with a medical degree, you can take risks, but you should be calculated risk. And work hard and keep a target and work on the target and achieve. That is my, that is my advice for you guys. So then I made the decision to come to United States. The United States is a country of immigrants. I felt I was accepted here. I didn't feel a difference. And always my father used to tell me, when you are in Rome, do what Romans do. So I made new friends. I didn't have the immigrant mentality. I wanted to stay as an American, but still I kept my culture, Sri Lankan culture. I introduced myself as a Sri Lankan American. Then I mingle with Americans, the different cultures, different people. I make friends, and I made this place my home. That is something really important. Okay. So then actually my objective, there are a few things I want to talk about. I think Ashan did a wonderful presentation to work abroad. So how do you feel and work in a different country in Europe, and the climate and all that, and 4 seasons weathers. And few things I like to add on to that about the medical liabilities. There are in United States, actually the medical liabilities, we have malpractice insurance all the time. There are different states. The certain states are called the tort reform states. That means their liability is less. For example, like in New York State, sometimes your liability could be like a 30 million US dollars, but still the insurance will cover it. But the tort reform states, like particularly the Republican states, their liability is only 750K. So compared to the liability insurance, like a 30,000 a year versus 7,000 a year, if you are working in a tort reform state, that's a good thing. And in the same time, you need to stick to the standard of care. We should not deviate, and we should not deviate from the standard of care. There are certain disciplines where you have less trouble. You document yourself, don't deviate from the standard of care. You do what is right and update your knowledge, and you show empathy, and take care of the patients like the way you are taking care of your own family. Always you have a chance, even you you do mistake. We are human beings, we do a mistake. But if you are a good human being, show empathy, you are professional with good communication skills, and if you have not deviated from standard of care, you still are covered. And with my career, like for the last, since 2005, for the last 17 years, I never had any malpractice issue. I'm a pediatrician, and I'm not attending now. I used to attend C-sections. I used to take care of very high-risk babies. And it's actually the inviting for malpractice, the claims, but we never had any issue. So I just want to tell you. The salary-wise, I really like to add on few things. The salaries, like during the residency period, salaries like between 50K to 65K, 70K, but that is only for 3 years. After that, the sky is the limit. Your salary can be ranged from like 200,000 to like a 500,000 US dollars a year. And in the same time, most of the doctors, depending what they want to do, they reinvest their money in business, and they reinvest on real estate. And some people, they reinvest on the share market. Some people, they reinvest on cryptocurrency. It's something I'm just trying to add on to what Ashan told before. And let me talk about the process, especially for the international medical graduate. When you come to United States, ECFMG is the Educational Commission for Foreign Medical Graduates. That is our med school. So we had a med school in Peradeniya, but when it comes to United States, that is considered as our med school. So that is the place where they verify our credentials. They check actually when we are registered, when we submit our dean's letter, transcripts, and all the certificates, medical degree certificate, they send those copies to Peradeniya. Then they check whether if this particular person really studied there. It's a secret envelope. They get it back. So then you get eligible to start, they apply for the steps. Step one is basically for basic sciences. It is more clinical oriented basic science. It is not really biochemistry. They are not questioning your chemistry. No, they are they give a clinical scenario. Then they are asking about related, the pathophysiology, if there is a deficiency in an enzyme, they're testing on it. So that, so on. So it's very interesting. And I had to be very honest. I learned basic sciences from USMLE. As I told you, I was an average student from Peradeniya, and it came handy. And my story, I entered med school in 1992, but I came to United States, it was in 2002. There was a 10-year gap for me. So I started from the very beginning, my basic sciences. And then I studied nearly 10 to 12 hours a day. And I did only studying, and I wanted to finish my step 1 and 2 and 3. I completed my step 1 within 6 months, and I finished my step 2, which is more clinical, the clinicals like internal medicine, pediatrics, surgery, and OBGYN, and psychiatry, behavioral sciences. So it is a 9-hour test, 8 blocks, 40 questions a block. The step 1 is like an 8-hour test, and the 7 blocks, 1 hour rest, and 40 questions one block. Then once you are done with the step 1 and 2, then you have to do they assess your communication skills. It is through the OET. I think you guys are aware about it. Once you complete all that, there are 6 pathways, I think, which is applicable for us. If we are licensed in another country, we need to get a letter of good standing, that is from the SLMC. Then you are eligible to apply for residency, and in the same time for the step 3. There are certain visa requirements if someone is applying for H-1B visa. So they need to have the step 3. And always the foreign medical graduates, we advise them to do the step 3 before they get into the residency. It is important. The residency is a different, getting a residency position is a different ballgame. It is a part of your marketing. Actually, you need to market yourself. I know one of the professors told, actually, you need to write a good personal statement, good CV, and you need to show, because if there is like 10,000, like, the vacancies, there may be 100,000 people applying for that spot. So we need to show them, we need to show our, like, the programs, how we are different from the rest, how we are unique, so how we are brilliant. We need to market ourselves. So there are certain things, actually, being myself, and there are some other, like, doctors like me who graduated and who came to United States in the same time, and we grow up together, and that we help each other. So we have an organization called the Slamana Sri Lanka Medical Association of North America. Whenever a Sri Lankan doctor comes to United States, I'm one of the resource persons. They give my number, and I get calls from different states, like, the states mean the states of United States. Dr. Ann, and I'm from here, I'm from Pennsylvania. I'm new to here. I came with my husband. Actually, he's a PhD student, and please help. So we guide them. So we guide them, like, we were very upfront. The scores are really important in USMLE. You need to get a good score. These are standardized tests, and we tell them, do the test when your score is guaranteed, when a higher score is guaranteed. Otherwise, don't do the test. Postpone it and do it when you're ready. Okay. And in the same time, we guide them, like, the writing the personal statements, and even we host them for observerships, externships, and we like to, like, give them a boost on their CV, and we help them on certain, we help them to find research positions, and the certain write-up, like, the certain presentations, abstract, and everything. We try to help each other. Just want to. And then these are the resources I like you to, like, I like you to consider that this material you can buy, and there are certain free material available on internet. The Kaplan Test Prep and Admission, actually, that's the place I work for. I work as a medical advisor before I started the residency. And so they have a very unique courses, and the reading material, Kaplan books, and they have Q banks, question banks. And the first aid for USML is step 1, 2, and 3. This becoming more popular now. And the U word, that's a question bank. And it is very important for you to, like, the concentrate on not only the question, but the explanation. This is really good. People learn, people study material through the Q&A, through the questions and answers. It's really good. It's really important. They explain it really good. And also they show, they, like, they teach us to find the answer. It's really hard. These questions are really, really, really hard. But they prepare our brain. They train ourselves to, like, to kill the exam, right? Like, to get the correct answer, they train us. Those questions and answers, they train our brain, and to get an answer, good answer. And what I heard, actually, these questions and explanations, even you decide to stay in Sri Lanka and do your postgraduate studies, it will come handy for you. It will come handy, because I know some of my friends, and I use this, the material, and for certain other foreign exams, and they were telling us those material were very good. And before you go to the questions, suppose, like, you schedule your, the step 1 or 2, I suggest people to do, like, this NBME, the practice test. There's a 4-block test you can buy. It's like $45. And that way you can, you have an assurance you will have a higher score. That is really important, because for you to, like, get a good residency program, you need to have a higher score on certain percentiles. Definitely over the 90th or the 95th percentile, you need to be on that, the mark range. And these are the two two resources. Actually, there are free. There are study groups on Telegram app and Facebook. And if someone add me on the Facebook, I can add them on those groups. And those are material, because sometimes if you have to buy those material, it is very expensive. I like to tell this in Sinhala. The people ape Lankawata Udatiyana Rate, there are a lot of students, the medical students, they study for this. They do their Engolo, when they were in the second year or the third year, they finish the step 1. When they are just done with the finals, they do the step 2. And they share a lot of free material. And in Telegram and in those Facebook groups, you can get all those free material. The Birds and Beyond videos, actually, they are good. You can refer them. The Amboss is the separate, the app. You can find a lot of resources for you to study, and it is important. This is the visa, the visa requirement. It is really important. If you have a green card for someone to get a residency, it will be really a plus point. Even without visa, it doesn't matter, but there are ways you can, get into it. The green card lottery, there are a lot of doctors, they come here after winning the lottery, and they go through the process, they pass, and they get the residency. I'm not going to talk much about the political asylum, but there are people, if there is an unrest in a different country, there is a possibility still. The United States is a very generous country, and they consider the people, the victims of uncertain situations, grant them, the citizenship or the PR, permanent residency. And the H-1B and the J visas, actually, those are very, very popular. And especially the spouses who come here as the PhD students, or they apply for H-1B and the J visas, and most of the people, but you need to have a higher score for that. But it's not difficult for a Sri Lankan or a Peradeniya graduate to, if you study right, and if you use the correct resources, you will be able to get a correct score for you to grab a H-1B visa or a J visa. And the other easiest way is the eligible bachelors, both men and women. If someone, I know you are, there is an opportunity. If someone get married or having a relationship with a US citizen, they will be available. They will have automatically, they will get the green card, and having a green card is a plus point for them to apply for the residency. I think another speaker actually highlighted about the masters, or if you are want to do a research degree, and there are ways where you can get into in the United States. I think she did a really a wonderful presentation. I think she may be a good resource person if someone wants to consider that path. And the Kaplan sponsor F1 visa, that's a student visa. That means suppose after your internship in Sri Lanka, if you want to come to United States to study USMLE, the Kaplan sponsor F1 visa. It's like a student visa. Then during that time, you need to complete USMLE, then you will be eligible for H-1B or the J visa. And that's the visa requirement. And I think, so it is, I do apologize, and it's 2 o'clock in the morning, and if I deviate from my script, and if you have, I'm open to any questions to take. And also, I invite, the best way to communicate with me, it could be Facebook. Please add me on the Facebook. And also, I think the moderator will share my email number. And that I think the best way is the Facebook. Yeah.
Thank you very much, Sam. Thank you for staying with us till 2 o'clock in the morning. It's very kind of you to join with us. Young doctors, you are welcome to ask questions. So I won't ask you to stay with us since it's so late for you, but we will definitely share your contact details, and you might find the doctors getting in touch with you at some point.
Yeah, good. Yeah, thank you very much. Thank you very much for the opportunity. And yeah, thank you very much, Tushara. And thank you very much for your.
Oh, thank you, Chandra. Thank you very much.
Right. So we move on to the last presentation, and I know we're behind schedule. Students, thank you for staying with us. And this is Dr. Saman Walisingha, who is the Vice President of PeMSAA, and he also has multiple other, I mean, he's in KSM, he's in DOWELS, which is the Doctors Welfare Society. He does a lot of other work, welfare work. And Dr. Saman, I do apologize for inviting you earlier and then having Dr. Ashan. But thank you for being with us. And we've talked to you, students, sorry, doctors. Sorry, it's very difficult to start thinking of you all as doctors. About your career path and what you can do. But please remember that there is more to life. And as you heard from Dr. Ashan and Dr. Sudath, communication, empathy, ethics, those are really, really important things that sometimes you may not see them in practice here, but obviously when you go abroad, they will be, core practices for you. They will be the center of the practice around you. And those are things that we need to change in Sri Lanka. They're really, really important. And they must become part of your life, part of your practice. And these are some of the, responsible citizenship is something that we want to talk to you about. And that's what we thought Dr. Saman would do. Dr. Saman, please go ahead.
Okay, thank you very much. Thank you, Champa. Good afternoon to all of you. And thank you, President of PeMSAA, Professor Buddhika Dassanayaka, for giving me this opportunity to address this future of medical fraternity. So I followed this session from the beginning. Then I felt sorry for myself because we didn't have this kind of informative session when we passed out in 1997. But so you all are really lucky, and please take the maximum use of this discussion. So I am a senior medical officer with 25 years experience. So my presentation is going to be a different one, but please bear with me. This time is not a good time, but please bear with me a few minutes. So my dear budding doctors, I got to know that you will get your results in few minutes time. From today onwards, you will get a tag in front of before your name, that is doctor. So congratulations for all of you. So also, you become an independent person from your family. This brings you a lot of other responsibilities. You will have to create your own path. You will have to manage your own financials. And basically, you will have to stand on your feet. So you, as a doctor in this society, you have some professional responsibilities as well as social responsibilities. I think Madam Abeysekera spoke about, he discussed more about this. I'm not going to discuss this because like human dignity, honesty, responsibility to society, to maintaining confidentiality, and maintaining your education, continuous education, freedom of choice, and responsibility to uplift the community. So these are your some of your social responsibilities. So being a doctor and a citizen, this triangle of needs is common to all of you. So you will have to meet these needs in your life. So basic needs, psychological needs, as well as self-fulfillment needs. So you need to take some decisions in your life. So timely decisions in your life and to get all these needs. So let me give some tips for you to take with you in your new journey. So I'm sure all of you have some dreams and goals in your life. So with my experience, I have seen some of the doctors, so they set long-term goals and focus only to achieve their goal. So what will happen if you set a long-term goal and focus only to achieve your goal? So you tend to, without your knowledge, you tend to create a tunnel between you and your goal. So when you go through this tunnel, so you may miss the most amazing things happening around you. Sometimes you will miss your family. Sometimes you will miss your friends. You will miss your loved ones, and you will miss the society. And most importantly, sometimes you will miss the core values. So by the time you reach your goal, you may be alone. So young doctors, what you can do is reach your goal with achievable, short-term and realistic, we call it realistic goals, where you can go at least with your immediate surrounding. So this will help you to enjoy your life and be proud of each and every step you take towards the goal. So when you become a doctor, you have to independently manage your salary, meet your basic and psychological needs. Let me share some of my life experiences with you. So due to my poor financial handling, I had to undergo a lot of hardships at the early years of my professional life. So I did internship in 1998. So Dr. Rannulu is my just 1 year junior to me. So nice to see you, Dr. Rannulu. So I wanted to buy a car just after my internship. I wanted to buy a car. So luckily, those days we didn't have iPhone 13 Pro. So mind you, my intern salary was just 7,500 rupees. The car I bought was 800,000 rupees. So I had no option than going for a bank loan. So after about 5 years, so then my second desire came. I wanted to build my dream house. Then again, I went for a bigger loan. With that, my savings drastically went down and became negative. And the end of the month, we found it difficult to meet our daily expenses. I think this is the bitter truth of most of the doctors in their early professional life in Sri Lanka, especially. So to make it worse, a bank offered me a credit card. Initially, it worked for me, but with time, I was in real trouble. Mind you, credit card is a good servant, but a bad master. You have to use it consciously with good control. For banks, you will be a good customer if you don't settle the monthly full payment regularly. So if you don't settle your payment regularly, they will sometimes increase the credit limit and the credit limit and make you spend more, and that will make you further down in your financials. So always take extra care when you use your credit cards. Never ever exceed your paying capacity. It's very important lesson in your life. So other option I had was to start a private practice. It seems like a good solution, but personally, it was not my passion. I started my private practice, but I wanted to quit private practice early as possible. So that was my only goal. So why is that? So I consider the private practice, especially the GP practice in Sri Lanka, is not a stable income source. It depends on many factors. If something happens to many factors, it depends totally on you. If something happens to you, your income collapses. At the same time, when you earn from your private practice, you tend to increase your expenses together with your earnings. And the net effect will be the same. So if something happens, your quality of life drops. Because the other thing is that you can't hand over this private practice to your family member. This is not a business. which you can hand over to your private, unless your wife is a doctor or your son is or daughter is a doctor. Also, the time you commit to your private practice is the most precious time that you can spend with your family and your friends and engage in hobbies and leisure activities. So my advice is, if you want to do private practice, do it with limitations. Have some quality time to be with your family and friends. So I think, so finally, I took my life-changing decision. I got an opportunity to work in Oman for 4 years. So believe me, within 2 years, I was able to settle most of my burning loans. And when I came back in 2014, I was financially stable. Since then, in 2014, I didn't do private practice. Now I have enough time to engage in leisure and social activities. So I'm an active member in Candidate Society of Medicine. I'm an active member in the PeMSAA, and I'm one of the members who started the Drawbacks Doctors Welfare Association, so which cater for about 1,500 doctors in the Central Province. So that allowed me to serve for many opportunities. So because of my free time, most of the time I'm free, and I can now engage in a lot of other activities and serve more. That created another arena in my life. So what I can suggest is, now you got to know about USA, the UK, and all the other opportunities in other countries. But from my personal experience, I can offer you another option. That is, working in Oman is a good option to consider for those who don't do postgraduate studies. It's for a temporary basis. So because why I say, the one reason is you don't want to do IELTS. You get a decent salary, no taxation of your salary, less cost of living when compared to European countries. And most importantly, Oman is a beautiful country where you can live comfortably and with less working stress. So if anyone wants, I can help you to give more details in the future. So let me tell you a few, because this is a small tip for you to keep in mind when you get your first salary. So from tomorrow onwards, you will be a doctor and you will get your salary. So once you get the salary, just keep this in mind. This is just, I'm not an economist, but this will help you to have some kind of a plan, because this is what I went wrong in my early life. So start with at least this, so then you can settle your life at the beginning. So go for this 50, 30, and 20 methods. Where when you get the salary, have the 50% for your needs, allocate, and 30% for your wants, and 20% you can have the savings. If you want bigger savings, so you have to compromise your wants. So how can you save your money? So that is the other option. So I also wanted to save money, but we decided to save at the end of the month. After spending, we decided to save money, but it didn't work. So my advice is that the basic of saving is, so what you have to do is, when you, just after you get the salary, reserve the amount for your saving and keep it in a place where you can't touch it easily, and take that only for your real needs and keep it there in a separate, safe place. So my dear budding doctors, so this is very important. You should be a good doctor together with your financial stability. So you being a doctor, you become a team leader, and always be the center of positivity, positive energy. Because when you go to your hospital, you have another team around you. So always be the center of positivity among this team. So how this positivity comes with motivation, core values like empathy, honesty, and integrity, your communication skills, so like that, how you have to have the ability to listen to others. At the same time, you have to have the ability to respect others' ideas and accept your weaknesses. So these things should go hand in hand with you when you work. Basically, a good doctor is a package. Then you will become the center of attraction. So that will come invariably. So you will be attracted to your co-workers. So people will start respecting you. So irrespective of your position in the hospital, they will respect you. So you can earn the respect by keeping this positive energy within the group. So keep this in mind and be a proud product of Peradeniya, and you can shine the future of medicine. So in nutshell, so what do you mean by success? The real success is when you achieve your goal and financial stability together with this whole package, especially keeping up with your attitude and your discipline together with you. So then, so everyone will respect you and you can be proud of yourself, thinking that you have achieved your success. So this is very, very important when it comes to when you step into your next journey from tomorrow onwards. Keep these things in your mind. This is very, very important. Always go with your values. Never forget the values around you. And always go with the people around you. Never forget the people who help you. So be with them, go with your values, keep up to your attitudes, and you will become really a successful person in the future. So my dear doctors, another small message from me. The good doctors understand responsibility better than privilege and practice accountability better than business. So always try, before fighting for your privileges, always try to understand your responsibilities. So this is very important for today's life because most of the doctors, they fight for their privileges, but they forget their responsibilities. So no matter how senior you are, no matter how the position, what is the position of you, so you may be a consultant, you may be a junior doctor, but you may be a senior most doctor. So you have your responsibility to your country. So do your responsibility, and then the privileges will come behind you. So be a good doctor, basically. So my final and the take-home message to all my young and budding doctors. So doctors are born with ability to change others' life. So always be the change in someone's life, and always with a smile in someone's face. So good luck and wish you all the best for a greater future. Thank you, and over to you, Chandra.
Thank you very much, Dr. Saman. And thank you very much to all the speakers. Thank you very much to the young doctors for staying with us. I'm going to share now. The chat is open. We've got some of our resource people staying with us. So if you all have questions, please post them. You are welcome to unmute and ask as well. I'm going to share a few slides with you just for some additional information, and also to highlight a few things that I think are important. So we've gone through that, right? So, I mean, please understand that, you know, there are a lot of choices available to you. That as everyone said, you know, the choices that you make in the next 5 years, you know, 5 to 10 years, some people start PG late, some people start early. You know, there's academia, which we talked about, clinical medicine, laboratory medicine. Some of the areas that we didn't talk about, but which are massive areas, which do a lot of work, which Dr. Hemapriya mentioned, are public health is one, medical administration, health informatics, right? These are areas that, you know, there's not a lot of prestige, well, actually no prestige at all sometimes, but the service you can do is phenomenal, right? and the courses are available, and we'll give you some contact information of people, alumni who can help you if you want to talk to them about, more information in this field. And then of course there is general practice, right? So these are the people that you can contact. Now we've talked to all of them and they are willing to help you. So in public health, there's Dr. Sudath Rannulu and Dr. Prasad Veerasinghe. And we will, the recording of this presentation will be made available to you. Also, you can take a screenshot. And these are the email addresses. In medical administration, Dr. Amila Maduranga, right? This is the email address. And in health informatics, Dr. Nishan Sirivardhana, who is not a Peradeniya graduate, but he very kindly agreed to, talk to those who are interested in this. And Dr. Sudarshana Vikramasinghe, who is abroad currently, but has the MSc in health informatics, also agreed to talk to you. So if these are areas that you all are interested in, these are areas that we didn't cover in today's presentations, but as I said, they are very important. And those of you who have IT skills, who are interested in public health administration, who don't want to go through the arduous training of clinicals and so on, look at these options. Then of course, for working overseas, for those of you who are interested, who want more information, for working in the UK, please contact this email, PeMSAA UK. You can go to their website, the PeMSAA UK website as well. And the PeMSAA UK has a mentoring program where they can help you to, navigate the process of finding jobs, getting registration, once you get there, assimilating to a new culture, because it's going and living in a different country can be very difficult, very different. It's not an easy change to make, right? For anyone, it's not an easy change to make. So they have a mentoring program there. And then for working in the US, Dr. Sudath was very kind to agree to mentor you all, so you can contact him. And of course, as he said, you can friend him on Facebook as well. Now, as Dr. Saman highlighted, please remember, and as many of the speakers highlighted, you all are graduating now to become responsible for yourselves. And before all this time, you all have fought for, what you want and your rights and so on. But remember, all of us have been very privileged to have a free education. And, we have also as students demanded this and that. But it is also time to start giving back, right? And to realize what your responsibilities are to the students who will come after you, to the society that you are going to serve in whatever capacity you are going to serve them. And so, maintaining your expertise, right? Continuous professional development, maintaining your ethics. And you saw with the speakers from both speakers from UK and US, how much emphasis is placed on communication, ethics, and how much litigation there can be in those countries for the relationship between doctor and patient. And those are things that you might not agree with right now, because that's not something you see here. But the thing is that empowerment of the patient, where the patient is equal to the doctor and it's the patient who has this power in the relationship, that is something that we need to progress to as a country, right? So in equal terms, PeMSAA has, I think, done a lot for y'all, right? In terms of infrastructure, in terms of education and so on. So y'all also please join PeMSAA. There is a lot more that PeMSAA can do for you in terms of your postgraduate training, but also join PeMSAA and contribute back to the faculty, right? The faculty has done a lot for you. The faculty did a lot for all of us. That is why we have joined, and that is why we are continuing to give back to the students. So you can join PeMSAA online. So you can go to the website, there's an online application, apply for full membership, right? For you, it will be provisional membership, which is free until the end of your internship. Full life membership is 1,000 rupees. If you can pay, then go ahead and pay, and it won't be provisional, it will be complete membership. But if you can't pay till the end of internship, we will give you free membership, right? I think that's all. Yes. Right. So I'll stop the share there. Right. Prof, right. So We haven't got any questions and it's almost 1 o'clock. Professor Tushara, would you like to make any closing remarks?
Excuse me, madam, I have a question.
Yes, please go ahead.
Madam, before that, I would like to thank PeMSAA for conducting this session for us, and it was really helpful for us, and we are glad to have this today. And madam, my question is, now as Sri Lankans, we are currently facing a crisis in Sri Lanka. So due to that, what will happen to our future professional careers as interns and as RHOs? Because the government has said that they will cut down the government workers and also they will restrict taking government workers for the government as well, madam. So what will happen to our future career, madam? I mean, for our internship as well as for our RHO period, madam. So that is my question.
Right. Thank you. Genuine concern. Professor Tushar, Professor Heshan, any input?
Yeah. Thank you. I mean, it's a very pertinent question he asked. Now, we graduated in the year 1998. Okay, so again we were in a same boat like you all. The country was in like economic turmoil even at that time, and we were told that we will not be given jobs. But things did change, right? And then time to time, we all face even in our lives, we face difficult and different type of situations. We overcome. Even the country should overcome this. But given scenario, yes, I agree with you. Probably you might. I think internship won't be a problem, but I am not entirely sure what will happen to you afterwards, because the hospitals will not be able to run without the interns. That's how I feel, and that the training should continue so that we maintain our services with time to come. So internship, I think there won't be an issue. So once you get your internship, then of course you are eligible to get the registration with the SLMC, and then you have better options. So I don't think you should be thinking about it now, and so hopefully things will hopefully change with time.
Thank you, sir. I know that, I mean, this is possibly with the reason that you all are asking is because you want to make a decision now whether you all are going abroad or, not. As I said, I mean, things have been bad in Sri Lanka before, things have improved. I know that as young people, it's very difficult to decide on something when you don't have all the information, and it's a very confusing time. But focus on, I mean, it's unlikely that everything will collapse immediately. So the likelihood that, you will be left without jobs soon after internship, and, suddenly you will be faced with the choice of having to go abroad immediately, or you won't have anything to do. That seems unlikely, right? Having said that, having a plan and then having a plan B and then having a plan C is not a bad thing, right? Because remember, whatever said and done, exams don't work out, and these are realities that everybody has to face, right? Exams don't work out, families don't work out the way you think, finances don't work out the way you think. So don't put all your eggs in one basket, right? Think about your options, think about your backup plan, think about another backup plan, and then don't fix yourself on that plan either. Things change all the time, right? I know that's not a very comforting way of living, and perhaps that is the reason why some people do choose to go abroad, because I think it's easier to plan and we feel more settled abroad than it is in Sri Lanka. But if you choose to stay here, then that adaptability is something that you need to get used to. Heshan sir, is there something that you wanted to add?
Yes, Champa, thank you very much. Yeah, so as Professor Tushar mentioned, I think all of you are likely to get your internship because you, after you pass out, you will only have provisional registration. And then for you to get complete registration as a medical officer, you have to undergo the internship. So I don't think that would be a problem. And then as of what the Postgraduate Institute of Medicine thinks just now, there has been no communication to curtail postgraduate training either. So for those who are coming into postgraduate training, I still think options will be open. And as Professor Tushara mentioned, maybe we need to think a little bit positively and hopefully think that things will turn around for the country. And once you are into internship and then your seniors, then they will automatically become RHOs. And then depending on what their outcome is, you would be able to get a clearer picture as to what would happen in the future and as to how things are progressing over the next 6 to 8 months. Thanks.
Thank you, sir. Anything else?
Yeah, just one comment. Can you hear me, Champa?
Yes, yes.
Whatever said and done, things will turn around hopefully sometime. Whatever you do, do your internship here. Finish it. Don't try to run away now. That is my advice.
Thank you, madam.
Yeah, shall I add something?
Yeah, sure, sir. Go ahead.
Yeah, so internship is really an important thing. Actually, that's the place where we learn a lot of clinical skills, hands-on and procedures. And even you go to a different country, like when you are a licensed physician from a different country, it will come handy. So recognition is more. And also, like especially when it comes to like interviews, the resident house officer means like a resident officer means like if it is like, you know, the hospital, not a general or teaching hospital. So like the resident officer is the person who runs the show. The consultant, you know, like, I don't know, during that time, like, you know, so that way, like, so you get experience, the confidence. I think it is really, really important to do the residency. And I think it's mandated for the government to provide for all the medical graduates who are graduating from Sri Lanka to give them the internship, regardless the government decision not to recruit any new government, you know, the jobs. I think my understanding is the internship is guaranteed in Sri Lanka.
Thank you, sir. Any other questions, students? So sorry, doctors. Right. It's just past 1, so I think we'll wrap up now. If you all have any questions, you can either, well, I mean, obviously you can text me or you can email it to the relevant resource person whose email addresses I shared. Recording of this will be available. I hope this was useful to you, and all the best for your results. I hope all of you all have done well, and all the best for your future. We wish you all the best. And of course, please join PeMSAA, please contribute back to the faculty, and please, you know, join with us in all the other work that we do. It's not just for undergraduates. PeMSAA, KSM, DOWERS, as Dr. Saman said, they do a lot of work in the community. Please join with us.
Madam, on behalf of my batch, I would like to speak a few words, madam.
Sure, Shan. Go ahead.
Regarding this invaluable session. We were actually confused and uncertain before this. Even if we were confused and uncertain before this, I'm sure it's much clearer for us. We actually didn't realize so much opportunities and pathways available to us, and after this undergraduate life, and we even realized certain aspects that we didn't really think about, like overseas immigration and so on. So we really appreciate the compassion you showed us to arrange this, because as Dr. Saman mentioned, he mentioned that we didn't really have this. So you thought about us and arranged this for us. So I want to thank all the speakers, Chandra, Abeysekera madam, Sardha Hemapriya sir, Buddhika sir, Veranja madam, Heshan Jayaweera sir, Dr. Ashan sir, Sudath sir, Saman sir. And I want to also specifically thank President of PeMSAA, Professor Tushar Kudagamana sir. And also special mention to Dr. Champa Ratnunga madam, the PeMSAA General Secretary, for liaising with us to organize this. And madam, I want to thank you all. And I hope this program will continue for the future batches as well. Thank you.
Thanks very much, Shehan. I'm glad it was useful for you. And yes, we will have this program every year. Of course, I mean, if you all have any feedback on, how we can improve or what else it is that you all want to know, please let us know, right? This program is for you. So, what are your burning questions and how can we answer them better? Please let us know, right? Email us. You can let us know, WhatsApp me. Thanks very much.
Okay, thank you very much. Okay.
Thank you. Thank you.